Okay, welcome everyone, and thank you for joining us today as I call to order this June 2024 joint meeting of the Raise Family Caregiving Advisory Council and the Advisory Council to support grandparents raising grandchildren. My name's Allison Barkoff, and I have the privilege of leading the Administration for Community Living. And for accessibility, I'll give a brief visual description. I'm a middle-aged white woman with curly brown hair, wearing a black suit and a flowered shirt, and I'm in my office with a flag and posters around me. And for anyone who needs captioning or interpretation, that is down at the bottom of your screen. So RAISE and SGRG council members, members of the public, federal, state, and local partners, welcome and thank you so much for your commitment to America's family caregivers. So much is happening as this meeting takes place, and so much excitement has been generated about the need to more fully support America's caregivers and the people that they support. The momentum we are seeing can truly be connected, directly connected to the work of the RAISE and SGRG councils. The 2022 National Strategy to Support Family Caregivers is truly shaping a national response to the needs of family caregivers and the people they support. The nearly 350 federal actions in the strategy and the more than 150 ideas for how states, communities, and a host of other sectors of our society can better recognize and support family caregivers, as well as the people they are supporting, have helped galvanize advocates across the country. I want to call out, for example, the Act on RAISE campaign, which is funded by our amazing colleagues at the John A. Hartford Foundation and led by the National Alliance for Caregiving and a range of partner organizations. The campaign is fully engaged with the national strategy and has a steering committee that has a long list of really important and diverse partners. Partners like AARP, American Cancer Society, AIM, the ARC, Caring Across Generations, Diverse Elders Coalition, Elizabeth Dole Foundation, National Alliance for Caregiving, National Council on Aging, National Health Council, Rosalind Carter Institute, and US Aging, plus many more. To see that kind of partnership and momentum with advocates truly is amazing. 5 years ago, when this work started, few of us would have thought that there would be an outside coalition really pushing to translate the work of this council, the work of this strategy into reality. And that coalition and that work is truly there because of the amazing work of these two councils. And of course, I'd be remiss if I didn't acknowledge that the creation of the councils itself by Congress didn't come out of the blue. It really came out of the fact that so many in the disability and aging communities, the caregiving communities, have been pounding on the table about the need to holistically and completely address caregiving issues. So thank you to everyone who made the work of the councils possible. But the councils have gotten from us the recognition and the need for action and for concrete coordination, and in so many ways, the plan is working. I also want to talk about the wind behind our back. The fact that we have an administration, a president, an HHS secretary who have made prioritizing the care infrastructure, including supporting family caregivers, a top priority, has been amazing. The fact that 2 years in a row, we have heard the president talk about caregiving as a priority in his State of the Union is incredible. And his calls around every agency prioritizing the care infrastructure has truly helped galvanize all of us across federal government. The CARE executive order has really fueled federal action, departments and agencies to roll up our collective sleeves and coordinate all of our efforts to advance the issues by caregivers. And again, this momentum from our president started over 3 years ago, and that momentum has now pushed our issues truly front and center. The Raise and SGRG councils have been able to tap into that energy. And again, the fact that in our initial strategy, we were able to get over 300 commitments from federal agencies and actions is incredible. And I really want to thank all of you who have agreed to serve on the councils as part of that continuum. I want to give you our gratitude, and also to all of you who previously served on the councils. Thank you. So let me turn a little bit to today's meeting. We will be talking about how this is a living strategy and really assessing where we are quickly making progress on policy and practical changes. And at the same time, we know there is much more work to do, and you will be part of identifying areas that need more focus and a door or two that we collectively may need to nudge open. I truly want to thank Greg and his team for their work. And please know, this is a priority, not only for our president, not only for my boss, HHS Secretary Becerra, but this is truly a priority for me. And I am committed to making sure that the work of the councils continues to be successful. Because the truth is that caregivers and the people they support absolutely deserve our best effort. They need to know that we are here and that we care about the issues they collectively face. So today's meeting, like all of the others before it, will be information-packed and engaging, and a major part of our agenda will be a presentation by the chairs of the RAISE and SGRG councils. They will present an overview of the 2024 Joint Update Report to Congress, which after this meeting, I am thrilled, we will move into clearance and work on getting that report released to Congress later this summer. So without further ado, let me introduce the chairs, starting with an introduction of Jonathan Cotter, co-chair of the RAISE Advisory Council. Jonathan has been both a caregiver for his son and his aging parents, and he has an incredible ability to meet people where they are, to understand their unique paths, to not measure the value of life in years, and to support others. Jonathan is the founder of the National Center for Pediatric Palliative Care Homes. Carol Zerniak is the other RAISE Advisory Council co-chair. Carol has 30 years experience as a social gerontologist and has both developed and implemented programs serving caregivers at the local, regional, and national levels. And she not only has professional experience, but she has invaluable personal experience, having supported her mother who lived with Alzheimer's for 10 years. Keith Lowhorn serves as the chair of the SGRG Advisory Council. He has served on several executive committees of nonprofit organizations, including serving for 16 years at the National Children's Advocacy Center. On these boards, he served as secretary, vice president, president, and past president, and he has a long history of leadership roles and a great reputation for decision-making. I would now like to pass the floor to Cheryl Thompson, who will conduct the roll call of members of the council. Cheryl?
Thank you so much, Allison. And we will call names by council members, but we'll start with our chair of both councils, Allison Barkoff.
Present.
Carol Zernial, and we'll begin with RAISE. Carol Zernial.
Present.
Jonathan Cotter.
Present.
Jesse Brasisco. Felicia Gibson.
Present.
Lynn Gall.
Present.
J. Neil Henderson. Sharon McDaniel.
I'm present.
Daniel Murphy.
Present.
Denise Myler.
Present.
Nancy Ritchie. Gloria Sanchez,
Present.
I'm sorry, this is Nancy Ritchie. I couldn't unmute. I'm present, sorry.
no problem. Thank you very much. Kezia Scales,
Present.
Deborah Stone Walls,
Present.
Jennifer Wolfe,
Present.
Liliana Chakrabarty,
Present.
Greta Kilmer, Jody Sumaraki, and I believe Jody is unable to attend. Melissa Harris, Catherine Capana, Diane Mitchell, Joan Weiss, Jolie Crowder,
Present.
Melissa Gerald,
Present, hello.
Helen Lamont,
Present.
and Jody Sumaraki will join us later in the meeting. Jennifer Bishop,
Present.
Rosemary Payne,
Present.
Lisa Schifferly, Courtney Simmons,
Present.
Carmen Sanchez, Sarah Glenn,
Present.
Margaret Cabot,
Present.
thank you. And now we'll move to our SGRG. Co-chair Keith Lohorn,
Present.
Donna Aginnica,
Present.
and Anna Baltron is unable to be with us today. And Tisha Chesterton, Carol Cox,
Present.
Megan Dobin McNabb,
Present.
Bert Hayslip,
Present.
Rainey Juski,
Present, it's Jusky, close.
Jusky. Okay. Yeah, we tried that pronunciation. Cheryl Miller,
Present.
Akila Ali,
Present.
Joan Weiss.
Joan will be
we have
joining
you. We have
shortly.
you. Okay, wonderful. Thank you. Valerie Jones. Michelle Archuleta. Amelia Carricker.
Present.
Emma Nye.
Present.
Atalia Sergi. I did have Atalia. Yes, Atalia Sergi. Beverly Yang is unable to attend today. Rebecca Ortiz. And Tammy Proctor.
Present.
Are there any names that I did not call?
Talia's present.
Yes, I did. I see her.
Okay.
Yes. Yes, yes. I was just waiting for the present.
Hi, this is Greta Kilmer. I missed my cue.
No problem. Thank you. Wonderful. Thank you very much. And
Okay,
with that, I
Cheryl,
will
is it
turn
me
back
now?
up.
Thank you.
Yes, I'll turn it back over to you, Allison.
Great. Okay, thank you, Cheryl, and thank you again, council members, for your ongoing work to make sure the strategy remains a living document and making sure we keep the commitments we made in 2022 as we really push the strategy to be implemented. So I am really happy to turn it over to the real deal. My team at ACL, I am pleased to hand the floor to Greg Link and Jonathan Weston, who will facilitate the rest of the meeting. So Greg and Jonathan, the floor is yours.
Thank you so much, Allison. And it is really great to be here with all of you for what I think is going to be a fairly exciting joint meeting of the RAISE and Grandparent Advisory Councils this afternoon. The primary focus of today's meeting really is to present the contents of the RAISE and Grandparent Council's joint update report to Congress. It has a heavy focus on the progress made by the federal agencies in their work to implement their commitments to the national strategy. And so our co-chairs will be walking you through an overview of the contents of that report, discussing some of the high-level attention that the strategy has gained since its release, and how ACL and our federal partners have really been leveraging that exposure and that interest to drive new developments in what we're doing. We're going to take a little break. And then one of the newest members of my team, Jonathan Weston, who I think some of you may know, he has a long history in the Aging Services Network, actually had a history in advocating for the passage of the RAISE Act in a former life. So he has a really good understanding of what we're about here today, is going to be walking you through a summary of the federal progress during the first year of implementation following the strategy's release. We're going to be looking at some aggregate data and then talking about what the federal update report that will be coming out a little later this summer will look like. Following that, we want to, he's also been, since his time with us at ACL, has been engaging with the federal members of the advisory councils to really begin to shape how we as the federal component of this initiative begin to look ahead to where our next steps go with the national strategy around better coordination and collaboration, around potential new initiatives that we see on the horizon. And so he's going to have an interactive discussion with the federal members of our council, during which the non-federal members of our council are welcome to join in, ask questions, pose questions, and be part of the discussion. We're going to be hearing from following a vote to move the report into clearance. And at the end of the meeting, I will talk a little bit more about the timeline that we are hoping for the clearance process that will lead up to the publication of the report. Following that, we're going to hear from our amazing colleagues at the John A. Hartford Foundation, the National Academy for State Health Policy, and the National Alliance for Caregiving to talk about the work that they have been doing to, number one, on NASHB's side, track implementation of the strategy by other sectors other than the federal government. And they're going to be teasing a little bit of a report, a progress and impact report that they're developing that will look at how the strategy is being used throughout our country by many different sectors to really show its impact at the community level. And then we're going to be hearing from Mike Whitkey at the National Alliance for Caregiving to give more information and details on their Act on RAISE campaign, which will involve their close involvement with all of our federal partners on the advisory council. We want to have an opportunity for our federal partners to get to know Mike and to get to know NAC and that work that they're doing so that we can move ahead in a collaboration that will hopefully be as beneficial and as mutually beneficial as our collaboration with NASHP has been. And that session will be moderated by Ronnie Snyder from the John A. Hartford Foundation. Following that, I will come back and we'll talk a little bit about the next steps for the clearance process and the release of the report, and looking ahead as we begin to think about the work needed to update the national strategy later this year, early into next year. So without that, I'm going to turn the floor over to our three amazing co-chairs so that they can walk you through the narrative components of this joint report that will be moving into clearance. The report was written largely by ACL staff. However, the council members all had time with this report to make it their own, to provide edits and additional content. And so the report really reflects the input and the thinking of our advisory council members. And so for that, I'm extremely grateful for the engagement of each and every one of you in the work that was done to develop this report. So with that, I will turn the presentation over to Carol Zernial, who I believe will kick us off. Carol?
Thank you so much, Greg. Appreciate it. So caregiving is a common experience that most of us will share. We're either going to be a family caregiver or need a family caregiver. And as you heard in the introduction, I was a caregiver for my mother who had Alzheimer's for 10 years. I took care of my sister who had cancer. And now I'm the only family caregiver for my father who's 93. And so caregivers represent millions of people. 1 in 6 of us will be caregivers. And all caregivers provide a large range of support from health to quality of life to independence for someone that we care about. And 2/3 of people as we age will need a family caregiver. So we've seen dramatic changes in the caregiving landscape due to the pandemic, due to the shortage of direct care workers, and due to the reliance that the healthcare system now places on family caregivers. So in September of 2022, the first Raise and Grandparents Councils took that important first step in addressing the need when they delivered the first national strategy for family caregiver to support family caregivers to the Congress and to the nation. And really, HHS Secretary Becerra summed it up perfectly that very first day when he said, "I know that we will create a better future for our American families because we do it with love, understanding, experience, and without a doubt, with the grit and determination that every loved one brings to caregiving for their family." So today, we're pleased to come together as 2 councils meeting together to report on the progress that's been made in the national strategy since its initial release in 2022. And I know I am very excited to hear from all of the federal partners and the progress that we've made. So before we present the overview of the joint 2024 joint update report on the status of the strategy's implementation, we're going to look at its legislative origins. Next slide. So the strategy was mandated in the RAISE Act, Recognize, Assist, Include, Support, and Engage Family Caregivers Act. And the RAISE Act was signed into law January 22nd, 2018, and it has 3 key components. The first is the formation of the Family Caregiving Advisory Council. It was first seated in August of 2019, and then the new iteration was seated last year. The second part is a delivery to the Congress and to the nation, that comprehensive report describing how we're going to, how family caregivers are challenged and the challenges they face on a daily basis, and the 26 recommendations for how we can address those challenges. And then finally, that national strategy to support family caregivers, which is grounded in the 26 recommendations. And while the RAISE Act called for the development for the national strategy to support family caregivers and created a path to do that, a little bit later in 2018, Congress also passed the Supporting Grandparents Raising Grandchildren Act. And while the Grandparent Act is similar to RAISE, it does not contain the requirement for a separate strategy for this critical and often overlooked population of family caregivers. But still, the Supporting Grandparents Raising Grandchildren's Act mandate is considerable. It calls for the formation of Advisory Council, which followed the same timeline as the Family Caregiving Advisory Council, a report to Congress, very similar to the RAISE Council's report, but it had 22 recommendations for how we can better address the needs of kin and grandparent caregivers. And then the gathering and dissemination of information and best practices for supporting kin and grandparent-led households, which has been a really key component of that council's work. So these 2 pieces of legislation and the respective activities they mandated led to the development and delivery to Congress and the nation in 2022, the first national strategy to support family caregivers, which was so exciting when it went out. So next slide. We know that family caregivers are far from being a homogeneous population. We are diverse. Each of us has unique needs, cultures, abilities, interests, expectations. And I remember when we first began work in 2019 and 2020, we spent a considerable amount of time considering the working definition of family caregiver, a lot of time thinking about it. And we have arrived at the definition that you see here. Family caregivers include people of all ages, from youth to grandparents, people with and without disabilities, people providing care from a distance, and people meeting a wide variety of needs, such as supporting people with intellectual and developmental disabilities across the lifespan, caring for people with serious and/or progressive illnesses like dementia and cancer, and assisting with daily tasks that can be challenging for older people and people with disabilities. The term also recognizes that a single person may receive care from multiple family caregivers. So I hope you see in that definition that we really worked to be as inclusive as possible across the timeline. So for our purposes in the grounding of the national strategy, the previous advisory councils adopted this definition and that includes youth, people of all ages, people with disabilities, people providing care from a long distance, and many, many others. This definition continues to serve as the President's Council North Star. We refer back to it again and again, and we began tracking across the implementation of the strategy and taking the steps necessary to developing the first update. And so we are realizing this vision of this strategy. So when the first two councils set to work collaborating on the first strategy, we envisioned a broad spectrum across the lifespan, whole of society approach, as you saw in the definition, for how we can better assist and support family caregivers. We took a lot of time. And if we look at these bullet points, the vision is a living and evolving document, helping the nation better understand and recognize the role of all family caregivers play, laying the groundwork for fundamental action by many sectors, including the federal government, but not just the federal government, to remove barriers and improve access to services and supports, creating opportunities for innovative thinking, collaboration, and partnering, and emphasizing the principles of equity, person and family centeredness, and the impacts of trauma and life events on family systems. Next slide. So we talked about the definition and we've looked at it across the lifespan. It's very comprehensive. And so now I would like to turn over the presentation to Jonathan Couture, my co-chair, to talk about the two councils and one strategy.
Great. Well, thank you very much, Carol. So I wanted to also kind of just do a quick introduction. I'm a proud dad. Our younger son was diagnosed with spinal muscular atrophy when he was 8 months old. He was very bright, but also very physically challenged. We were told not to expect him to celebrate his second birthday. He lived an amazing life until his death at 17 and a half years old, which was December of 2018. And then again, last year, I was able to draw upon my caregiving experience from caring for my son. When my 90-year-old dad died, dementia had become a factor in his last few months of his life. So I can truly appreciate caregiving across the entire lifespan. So let's go to the next slide. So as the previous councils worked together to develop the strategy, they realized that they shared a common set of goals for how to improve our recognition and support of family, kin, and grandparent caregivers. They also realized they shared a common vision for how the strategy could be put to use most effectively. For example, given the breadth of its contents, it was seen as a tool for better aligning multiple sectors' responses to the needs of family caregivers. It was also seen as a resource for facilitating collaboration across sectors and within organizations. And it's a roadmap for advancing equity for all family caregivers. Next slide. So the national strategy consists of 4 interrelated components intended to advance a whole of society approach to how we think about recognizing and supporting family caregivers. The first component is the narrative, which provides an abbreviated background on the breadth of family caregiving and helps to contextualize the issues addressed throughout the 4 components of the strategy. The narrative further lays out the five organizing goals or actions areas around how the strategy is organized. Increase awareness of and outreach to family caregivers, advance partnerships and engagement of family caregiving as partners in healthcare and long-term services and supports, strengthen services and supports for family caregivers, ensure financial and workplace security for family caregivers, and expand data, research, and evidence-based practices to support family caregivers. The first principle describes 4 cross-cutting considerations that must be reflected in all we do. Placing the family and person at the center of all of our interactions, addressing trauma and its impact on families, advancing equity for families in underserved communities, elevating direct care workers as partners in family caregiving. The final 2 components lay out the nearly 350 actions federal agencies committed to at the time and a comprehensive listing of possible actions for the many other sectors of our society that all have a role to play in supporting family caregivers. Okay, next slide. As the initial strategy was coming together, I've come to learn that the first council expected it would deliver a great number of things, and realistically also have some limitations as well. This thinking was intentional. The strategy would be a big picture and articulate a vision and overall roadmap for change. It would begin to set a baseline for actions to progress these ideals. Understanding that caregiving is about unique individuals and experiences, it still is important to establish an overall common framework that can be then used by many stakeholder groups. This is a large-scale undertaking that will take time. At this stage, it will not be a timeline or a how-to, nor can it list all the specific requirements to the myriad of situations, topics, and conditions. Again, this is a big picture pushing off point as a start, and it'll continue to evolve. Next slide. It's also important to remember that the national strategy to support family caregivers is just that, a national strategy. That means it's not just a plan to be followed by the federal government, although we know that the federal government's role in this effort is critical. The strategy was, and still is, intended as a roadmap for many audiences. For example, I'm excited about this because my personal areas of passion are around families with children that have medical complexities. This list highlights some of the many groups impacted, such as community-based providers, child welfare agencies, program administrators, legislators, and policymakers and advocates, among many others that represent a full lifespan. As the joint report we are presenting for clearance today lays out, and from another that our colleagues at the National Academy of State Health Policy will be releasing a little later this summer, we believe the strategy is being used by these sectors and many more. As a result of the strategy, for the first time, many sectors of our society are being educated about the presence of family caregivers and the importance of supporting them through new policies and practices. For example, we are seeing new momentum with counties and county governments in work that they've done with NASHB. The business community and employers are taking notice of the needs of their employees who are family caregivers. Child welfare systems are taking more proactive steps to recognize the critical role kin and older relative caregivers play in the lives of children in need of stable, loving homes. After the strategy was released, ACL opened a 60-day period of comment to hear the public's response to the strategy. Keith, let's take it from here.
Thank you very much. I appreciate that. Jonathan, Carol, thank you for a great start of the day. My name is Keith Lohorn, and I am the co-chair of the SGRG. And let's just say that my wife and I were raising grandchildren that were born addicted, and it's been a much of a challenge, as you know, for grandparents across the country. And it's just an honor to be here, and hopefully we'll get some results from this. So thank you very much. So next slide, please. Here we go, right here. In the 3 months, thank you. In the 3 months of soliciting comments, over 1,000 responses have been recorded. That shows the proactive and solicitation of input to our work continues to be the hallmark of the RAISE and grandparent councils, as it has since the beginning. The ACL and both councils have and will always welcome the input and ideas from the public. The formal request for information issued by the ACL early in the work has allowed the councils and our partners at the NASHP and elsewhere to hear from constituencies to learn about the most pressing and important issues facing family caregivers, as well as generating ideas for how to address them. That very important tradition of public engagement continues today with the release of this strategy. We heard a bit about the outcome of the public comment period during our September 2023 meeting, but I believe it bears repeating here as we look forward to issuing the 2024 joint update report and an updated strategy later on. Next slide, please. The public comments were also analyzed to learn where we need to move next with respect to the much needed and greater recognition and support of kin and greater recognition of those supporting grandfamilies. Comments to the strategy were wide-ranging and diverse, but were clustered around common themes. For one, financial and other supports desperately needed by our families aren't accessible as they are available to our foster parents, and we both are providing the same, if not more important caregiver roles as the grandfamilies. Kinship caregivers also want access to trainings, respite care resources, and peer supports so they can share strategies with others in the same situations. Those folks commenting also talked about the need for information and referrals to resources about the specific and challenging conditions our children may encounter. Those conditions include attachment disorder, intellectual and developmental disabilities, extreme difficulties at school, and many more. Finally, commenters expressed the need for legal help and guidance on a wide range of issues. Next slide, please. The comments received from the public in response to the strategy were studied and analyzed by our colleagues at the Leading Age STSS Center at UMass Boston. Both the RAISE and grandparent councils were presented with a great analysis report with important information to consider as we look forward to updating the strategy. The top line priorities outlined in this graphic are not surprising to either council, including addressing the affordability, quality, and supply of direct care workers, as well as long-term services and supports, caregiver trainings, and access to respite, as we all need an occasional break, just as you're about to get in a few minutes. Additionally, improved systems for mitigating the financial and workplace impacts of caregiving and the highly important need of expanding paid leave policies, paying family caregivers, or offering other financial benefits, and encouraging businesses to have caregiver-friendly workplaces. As both councils have been meeting in subcommittees and working groups to begin the work to update the strategy, we are focusing on these top priorities as a starting point for where the next strategy needs to go. Thank you very much. Is it time for a break?
Well, thank you all to each of the co-chairs for presenting the contents. Was there a next slide here, please? Okay, so before we take a little break and move on to the federal report of the section, we wanted to open up just for a little period of discussion among the advisory council members. You know, you all had spent some considerable time with this report that we're going to be moving into clearance, voting into clearance later today. And what we were very interested in hearing, and I'm sure that members of the public who are tuned in would be interested in hearing some of your impressions or some of the other thoughts that you had as you read and reviewed and really put in some amazing feedback and input into the report yourself. So if anybody wants to raise their hand, council members, please feel free. Was there a particular, Kezia, go ahead, please. Floor is yours.
Sorry for the delay, and thank you. My name is Kezia Scales. I'm a member of the Family Caregiving Advisory Council. And just because you opened the floor for input, I just wanted to share that going into my role on the council this year, I felt that the strategy was incredibly comprehensive and detailed and all encompassing. And sometimes when you then spend more time with something and you start to pick it apart, your impression changes. And I just want to really say that it has not changed. My respect for the proposal and how robust, or the strategy rather, is how robust it is and how all encompassing is just very impressive. And I think it was a really positive challenge for the councils this year to really think about how can we take what is already so strong and move it even further forward. And so it's been just a real joy to be part of that process, starting from such a strong place.
That's a great observation, and I really appreciate it. I know that for a couple of the members of the advisory council who are returning members, I know that they would be gratified to hear that. And as representing ACL, it also is very gratifying to hear that. When the first advisory council set to work developing that initial strategy, they were starting from zero. We had a lot of great public input. We had incredible support from NASHP in helping shape their thinking and helping them come to decisions on what the goals would be, what the recommendations would be, and really providing us with some great research and understanding of where potential actions for the non-federal parts of our society could really go. And so I love the fact that you see it as comprehensive. And I think it will be a very interesting and fun challenge as we move forward now with seriously beginning to update the strategy. Is how can we get more refined? How can we get more creative? How can we think a little bigger? And that's where I think the combination of our non-federal members and the federal members of the advisory council and the relationships you all have already started to build in our subcommittee meetings will really come in to play. And so I'm looking forward to the next phase of this work. Jonathan.
Yeah, I just want to echo that too as well. As a person coming onto the council for the first time during this now session, we got to take it. We had the benefit of the first council's 3-year work to create something from nothing. And then as a new person coming on, there is a lot of information in here. And so what I have been very impressed with how the council meetings have been happening, and is just the openness and the willingness to allow the new council members to also provide input into this. And so there was a little bit of we needed to catch up, because I certainly didn't have the experience with a lot of the federal systems and the information that was created these last 3 years. So we did have to have some adaptability and flexibility to kind of go backwards a little bit to just get caught up and get the baseline level of knowledge created. But now it's really about, providing that input. And I think everybody's just been willing to hear new thoughts, new input, and just continue to move this all forward. So I just really appreciate that.
To the members of the advisory council, once this report is released, do you all see opportunities within your own networks? I mean, each of you is incredibly well connected in your respective networks and with the constituencies that you represent. What opportunities do you see to disseminate some of the exciting information that will be in this progress report with everything that's happened in the year plus since the strategy has been on the street? Any thoughts there? Carol.
Yeah, I don't think I've had any conversation where I have not talked about implementation of the strategy. So the excitement for me is to take all of the feedback that we've gotten from the public, to take the report to Congress, to take the strategy, all of it, and create a glide path to implement it. It's so exciting.
Yeah, and around the implementation, I'm going to be when we reach the federal portion of our meeting after the break. I'll have an opportunity to talk about what ACL has been up to just in our own little corner of the federal government to support implementation of the strategy. Deborah.
Thank you, Greg. I was gonna mention the federal portion, you may or may not know that as a member of the federal government, sometimes the sentiment around America may not be so positive. And I think this strategy gives us an excellent, tangible product to point to say, look, everyone's getting engaged, everyone's buying in. Look at how much has already been accomplished on the federal government level, on the state levels, at local levels. So I appreciate the practicality of it. I appreciate that it highlights all that's been done, but it also points out, regardless of where an organization or an individual fits, there's something they can pull and use to move forward. So it is, I think, a lot to be proud of. And just the way that it is organized to be so tangible does make it very easy to put forward, as Carol mentioned. It's very easy to reference, and just, it's a tool that we can point people to where they can actually glean ideas and ways to move forward.
Thank you, Deborah. And I see in the comments from Gail Engel, who was a member of the previous Grandparent Advisory Council. And she said, for those of us who sat on the first council, I will tell you, we continue to impact our communities because of the work we did. New members will by all means have further impact as we move along. And I think that's very, very true. Rainey, please.
Well, it's really been said already. I think I see this as being an incredible tool to move the story further for kinship families, grand families who are they fall between the cracks. And I hope that this document will help to raise awareness of their needs, because we'd have a foster care crisis if they weren't willing to step up and take in their grandkids.
Absolutely. Absolutely. Jennifer.
I just want to echo the comments that have been made about how important this national strategy is in elevating the visibility of family caregiving and creating a community of organizations and federal and non-federal momentum towards both identifying and then also addressing the challenges experienced by family caregivers. I come from the research perspective, and often research takes a long time. And so I think from my vantage point, the incredible progress that's already been made will only be amplified as we move forward, and the federal stakeholders and advocacy organizations increase their consistency in thinking about definitions and measurement, and having infrastructure to really be able to shed greater light on the topic, as well as the progress that we make in addressing some of these important challenges.
Thank you. Thank you, Jennifer. We're really pleased to have your perspective as a researcher on the council. Lynn.
Hi, everyone. Lynn Gall from the state of Wisconsin. I just wanted to say something from the state perspective, in that the report that's going to be coming out. Let me do that. I think it's great that it's showing with the federal government and their dedication and what really everybody pulling together. But from the state level, I look at this as sort of an opportunity for us to take it at the state and community levels and be like, okay, this is what the federal government can do, it wants to do, has been doing, but they can't do it all. And for us to really kind of help pick up that ball and run with it at a more local level, because it really does have to happen that way. And so I'm really looking forward to having, this come out, and for us to be able to point and say, oh, great, maybe we could do something similar to what they've done at the federal level, or take it a step further. And because we all have limitations on funding and ability to do certain things, but together we really do have a great capacity. So looking forward to that. Thank you, everyone.
Great. And Nancy, before I go to you, there was a great question in the chat. So, can you provide examples or tangible examples of changes that have or will impact family caregivers based on the existence now of the national strategy? In my work, with other federal departments, but also even in just ACL alone, the national strategy has given us a framework to think about how we structure many of our discretionary grant programs that actually provide funds to states and to communities to develop programs and services for family caregivers and the people that they support. For example, the caregiver, this series of 5 grants that national projects that we launched to provide technical assistance to the Older Americans Act funded aging network that provides the National Family Caregiver Support Program services. We're working with those 5 grantees and with our states, our communities, our tribes to really infuse the best practices that are available from around the country in strengthening how they're delivering services and supports to family caregivers. The strategy gave us the framework for structuring a project like that. I've heard that local respite care programs, for example, are using some of the ideas contained in the strategy, some of these very basic ideas for how they can expand the availability and quality of respite services in their communities just through some of the ideas that were articulated in the services and support section of the strategy. And in fact, one of our real great collaborators at the ARCH National Respite Network and Resource Center has developed an entire curriculum around training for respite workers to make sure that they have the competencies and the skills that they need to provide respite in many, many different types of situations. Again, all of this has grown out of the existence of this basic framework of the national strategy. So many more examples, and we're going to see even more of those examples in NASHP's Progress and Impact report that will be coming out late this summer, maybe around September. They're just wrapping up their data gathering for that exercise. Nancy.
Thank you, Greg. And this kind of follows along with what Lynn just said about state and local communities. I mean, certainly there's no question that the federal progress and commitments and actions are massive. And I am personally just as excited about the 150 plus state and local community recommendations. And I'm finding here in Pennsylvania that even just to make people begin to be aware of the whole world of family caregiving, sometimes it's just like, oh my gosh, I never thought about, how massive the role is of family caregivers across the lifespan. So we're seeing in small areas and especially in rural areas that it's prompting people to think creatively and come up with things that will work in their own local areas. So I really appreciate that the first group of the advisory council put also so much emphasis on the state and local community possibilities.
Great, thank you. And I just want to call attention to another great comment, and it's from a member of the public. AMK said, please be sure to define respite. As a caregiver and advocate, respite is not the same from one person to the next. And you could not be more correct on that, AMK. Respite is a very unique experience and a very unique service for each person. That's why in the strategy, we do provide some definition of respite, recognizing that it could mean something different to everyone who receives respite. But it's also important to make sure that in the spirit of person and family centered approaches, which is one of the founding or the basic core principles, those cross-cutting themes, that services and supports for family members have to be developed in a way that it will meet their needs where they are when they have them. So this a real strong focus needs to be on ensuring that everything that we do is done with an eye towards a person and family centered approach to how we address the needs of families and family caregivers. So we are right at 1:30. We are running just a little bit ahead of time, but that's never a bad thing. We are going to move. We're going to take a short break, about 15 minutes. And then after that, we are going to hear Jonathan Weston on my team is going to lead a discussion with the federal members of our advisory council. He's been having conversations with each of them since he came on board approximately 6 weeks ago. And one of the things that he will be doing is talking with our federal colleagues about where they see things moving next for them in terms of what federal agencies will be doing next in support of the strategy, among other things. And I also want to encourage the non-federal members on our advisory council to ask questions, to be engaged, because this is a great opportunity for the non-federal members of our advisory council to connect more closely with and begin to really interact with your federal counterparts on the council. So we will look forward to that. So I know that this is probably the portion of the meeting that most people are most interested in, and I am too. It's been quite a journey with gathering and reporting on developing this report on what the federal agencies have accomplished since the strategy was released in September of 2022. And so I'm really pleased to have Jonathan Weston, who has recently joined the Administration for Community Living in my office as an aging program specialist, working with us across our caregiving portfolio. For those of you who don't know Jonathan, he has many years as a trusted health policy advisor with over 2 decades of experience in the areas of public policy, health strategy, and nonprofit management. His principal focus is on aging policy trends, and he's developed a strong track record in long-term services and supports policy arena as a reliable source for both the nonprofit sector, government officials, and thought leaders on aging services delivery and finance reform. He's delivered value to networks of health and aging providers and has worked with both appointed and elected officials on ways to improve the nation's health and aging services delivery systems. So, and John has a Bachelor of Arts in Political Science and his Master's in Public Administration from the American University. And I'm just so pleased to have his expertise supporting the work that we're doing. For those of you who have been following this work since its inception, you'll know that Lori Stahlbaum has been and continues to be my co-partner, my partner in crime in all of this work. And I'm always and forever grateful to her insights, her wisdom, and just her incredible skill in making all of this work. And so now I am equally thrilled to have Jonathan and his background joining the team. Since coming on board at ACL, he has spent a considerable amount of his time getting to know the federal members of both advisory councils, getting to understand what their experiences have been in leading their agency's work to implement the strategy, and also brainstorming with them and doing some visioning as they look ahead to our future work together. And so I'm really pleased to turn over this portion of our agenda to Jonathan, who is going to first talk about the progress that the federal agencies have made in a very aggregate form, And then he'll be engaging with our federal members and the non-federal members in some discussion. I would also like to encourage members of the public, as you're watching, if you have comments or questions, place them in the chat. We will try to get to as many as we can. And all of your comments and questions are captured, and we can make them part of the meeting notes for this meeting. So without further ado, I'm going to turn the floor over to Jonathan to begin this portion of our meeting. Jonathan.
Greg, thank you. Thank you so much for your kind words, your patience with me over the last 6 weeks as I get on board. And really, you're just your incredible mentorship, which I deeply appreciate. I've certainly truly enjoyed my time at ACL, learning about the agency's primary objectives and the exciting initiatives, such as family caregiving, RAISE, and SGRG councils, which exist to meet these goals. So I know that we have several of my old friends joining me as observers, and many of my new friends as well. And I want to express particular gratitude to the federal members of the RAISE and SGRG councils that we'll be hearing from shortly for their efforts in enlightening me as to what they feel are priorities. And I'm sure pretty soon they'll be enlightening you as well. The opportunity to speak with them has truly been extremely helpful to me, and I'm convinced that it is just one of the pathways that we can utilize to coordinate more effectively and have a stronger RAISE SGRG strategy moving forward. For those of you that I have not spoken to yet, I look forward to being in touch with you shortly. I have the distinct pleasure to present information that I think is of the greatest importance to this field. It is the progress that has been made by the federal agencies in their nearly 350 actions in this strategy. In our time together for this portion of our agenda, we'll be discussing how federal agency progress is tracked. We'll look at the status of each federal agency action, and we'll also look ahead where we go next in our work on these vital matters. Got the slide, thank you. So tracking federal agency progress really is something that is of a key priority for us. Our first call for updates occurred about April 2023, approximately 6 months after the strategy was released. Our second call for updates came in the fall, in October of last year as well. We're very grateful to so many of you who joined us today for those updates and for your comments and feedback, which were referenced earlier. When you look at the status of actions in the report that we'll be releasing, you'll be seeing that we're about 1 year post-strategy release, with a few exceptions. But let's focus first on very notable federal accomplishments. And before we do that, if you can go to that next slide. Let me just raise my volume here. Just got a request to do so. I hope that you all can hear me better now. If not, I know that our folks will let me know. Oh, great, thank you very much. So rarely do I have a question coming from anyone saying that I'm speaking too softly, mainly I'm speaking too loudly. So my apologies for those that could not hear me earlier. So what we're going to do is we're going to go over this summary of key accomplishments, and then we're going to have a description of additional action as reported by our federal partners. Then finally, we're going to be taking a look and continually analyzing the spreadsheets, detailed progress by each of the agencies, the so-called trackers, as we call them. Next slide, please. So there are some notable accomplishments, and before we get to this aggregate slide before you, I just wanted to highlight several. So the Administration for Community Living, or ACL, issued guidance to states to ensure that new state plans on aging reflect and advance the actions of the national strategy. In addition, the Health Resource and Services Administration disseminated new family caregiving training to their geriatric workforce education program, commonly known as the GWEC. The Administration of Children and Families, ACF, updated several key federal regulations that will further strengthen the support of child welfare agencies' efforts to embrace kin-first culture. And the Centers for Medicare and Medicaid Services, or CMS, issued in the final 2024 physician fee schedule Medicare payment, a Medicare payment for family caregiver training, certainly a watershed moment for the work of CMS in this arena. CMS also issued a new guiding an individual dementia experience called the Guide Model for some Medicare beneficiaries and their families. Families dealing with senior caregivers. There's also been a development of a curriculum with the Substance Abuse and Mental Health Services Administration, or SAMHSA, and the Federal Emergency Management Agency, FEMA, to provide peer support for caregivers during emergency situations. We're in the home stretch now of these, but they are just remarkable when you take a step back and look at the progress that's been made so far by our key agency partner. There's been new engagement of AmeriCorps senior volunteers to provide respite care to caregivers. What's also exciting is since this strategy was released, there have been 40 additional actions submitted as an aggregate by our federal agencies. And these additions come after the release of that strategy and are largely the result of the momentum that we created, the opportunities federal agencies had to look even deeper at their existing authorities for ways to better recognize and support family caregivers. So when this report is published, we hope published later on in the summer, of course, we're very eager for your feedback as we move forward. But you'll see regarding federal agency progress will include a narrative and summary of these key accomplishments, description of each additional action as reported by federal partners. You'll also see in those trackers some of the information I gleaned from what I've just read to you in the narrative, those agency Excel spreadsheets that detail progress on each action by each of these agencies moving forward. We'll get back to that in a moment. So I just wanted to highlight the status of each action and what they need. So here's our aggregate spreadsheet right in front of you. Thank you for all the folks that really helped not only participate in the way of data, but construct this sheet and really separate out these key actions in the respective buckets that we see. So there's completed. There's also, of course, in process, not started. There's also modified. For whatever reason, modified means that there has been a shift in agency priority or programmatic focus. And finally, there are those actions that have been on hold or canceled at this junction. So same as for modified. So let's take a good look at this data moving forward. And here are some of the takeaways, at least that we gleaned. We're always eager for the federal agency feedback, and we'll be hearing from them shortly. So nearly 1/3 of all the HHS actions, 84 actions out of 270, are now completed. 1/3, amazing progress by HHS. 157 are still in progress. So there is still considerable work to be done. And I think that my takeaway from that is the prioritization that's occurred within HHS with all the different moving parts and priorities of this massive department and how family caregiving is categorized. And though I'll say this again, it bears repeating, we are so grateful to all the federal members that have made this happen, particularly the very enterprising team, very brilliant team at HHS and what they've done. So we take just a piece of HHS. Let's look at the ACL, our own agency as a subset. The agency is tracking a similar path. Right now, we're at still a little bit over 1/3, 36 out of 99 goals that ACL was tasked with have been accomplished to date, with 50 actions still in progress. So again, where we are on this and what we've accomplished is, frankly, I think amazing, if I can insert my opinion there. So the Center for Medicare and Medicaid Services, Centers for Disease Control, the Indian Health Service, and the Health Resource Services Administration, as you can tell by this chart, are also making very strong headway in achieving the goals that they've identified and have also been tasked with. There are interagency efforts as well, which are defined by knowledge sharing, communication. These are paramount regarding RAISE and SGRG goals of strengthening our work collectively across HHS and other key departments through one-on-one discussions and a better understanding of the agency department initiatives. The council's respective work will be stronger, resulting in more effective family caregiving across the board. We very much, ACL and HHS overall, look forward to working together in this inter and intra-agency capacity, given the next opportunities to shape the federal government's strategy. I do hope that we can hear from other council members with their questions as we move along to the next session. I'm going to be pausing in just a few minutes here, a few moments, to see if there are any questions. So for those that might be marinating some questions, we certainly, after all this data, certainly are very eager to hear from you before we move on to our federal members. So feel free to ask our federal representatives anything. We have that handling material. On behalf of my ACL colleagues and myself, I extend huge thank you to our federal partners on the council for your patience and diligence. Came to you repeatedly over the past few months, not just to make sure that we are capturing as accurate information as we can, but we came to you for your guidance, your wisdom, your crucial feedback, your vantage points and perspective on what RAISE and SGRG mean to you and to your agency. So before we move on, let me stop for a moment and ask for perhaps any federal partner comments or non-federal member questions that might be had by the council at this juncture. We'll pause if any questions have come in. Let me go and I could take a look at these. Very good. A question from Jason Resendez, National Alliance. It looks like there are 385 actions here. Does that mean that there are 35 more that were originally established by the plan? Yes, remember Jason spoke about that earlier in a way that this has sort of been like peeling back an onion to a certain extent, in the way that the agencies have taken a look at the strategy, they've taken a look at the goals, and there have been some modifications to them given further thought. So that's really the I think the differential that you're seeing. Very good. We have another question here from Michelle Bolden. Will there be any initiatives to set federal minimum reimbursement for federally funded Medicaid waiver programs that support family caregivers? I'm not sure right now if that's in the scope of this matter, but we can tackle that.
Yeah, that's John, this is Greg. That's a really difficult question to answer. That would certainly be within CMS's purview. We're waiting for our CMS representative to join us in just a few minutes. But you know, in the federal sector, one of the things that's a little difficult for us to do sometimes is to talk about policies or new initiatives that are under development, particularly if they haven't been vetted through departmental channels up through the White House, to make sure that you know, they're in line with the administration's priorities. That's one of the things that has made implementing the requirements of the RAISE Act somewhat challenging for federal agencies. You know, the statute limits us to taking actions that are within our existing scope. So that means, you know, within the existing scope of our legislative authority, statutory authority, and also within our existing resource authority. And oftentimes we don't know what we'll have to work with from financial resources into the next year until we have our final budget from Congress. And so it's only then that we can begin planning in a concrete way for what we're going to be able to do. The same thing would go with major legislative proposals, or in this case, you know, initiatives to set minimum reimbursement standards. There may be activities underway, but they're not ready for public discussion yet.
Great, thank you very much for that. I do want to, really very helpful. I do want to recognize, if I can, for a moment, Jolie Crowder, who is one of the federal members. I know that she's had her hand up. So Jolie is with the Indian Health Service. Jolie, looks like you have a question before we move on to the panel.
Maybe this is a statement like while I'm on the panel, but I just actually wanted to point out, like, I'm jealous of all the completed federal action items. And so, like, as we sort of provided our update, I think like a lot of our in process are things that are going to be ongoing. So we have started, for instance, some outreach and awareness efforts, and that's something we're going to plan to continue. And so I would maybe never mark those items complete, other than to say that we have lots of things in the hopper that we see as sort of long-term initiatives. And maybe that's a language clarification in the future, but we've done something on everything, but they're just not things that I would ever say, done, check, move on to the next. So excited to see all the progress by everyone.
And Jolie, that's a great point. And as we began tracking progress on the federal actions, we came up with these categories that you see: completed, in process, to be modified. And as we were working with our other federal agencies, it became clear that we're probably going to need a new category, because there are some things that are never finished. They're never going to be completed. There are these ongoing programs that we have that can continue to evolve over time, or are something that we do every year. For example, you know, ACL always recognizes National Family Caregivers Month during the month of November, and we have a set of activities and social media pushes and information sharing that we do. That will likely always be ongoing, so it'll never be completed. So we're going to be rethinking in the future how we report some of the progress. Some things will be completed, they're one-offs, but others may be more of this ongoing approach to our work.
Thank you, Greg. And thank you, Jolie, for bringing that up. And I guess we'll get back to you on that, but we really appreciate what you've done. And you know, you guys are, I mean, looking at this list here, out of the 15, you've completed five of these actions already. So it's quite impressive, and we're very grateful to IHS for their assistance on this. What I'd like to do at this point, chat, questions and all of that, is to make sure that we provide ample time to hear a bit more from our federal members on the council. They truly are our partners, and we deeply appreciate all of their efforts. This is to see where they see and view their work moving forward as we look ahead to updating the strategy. So as I mentioned earlier, I've had the opportunity to speak with many of the federal members of both the RAISE and SGRG councils, and I look forward to having further conversations with those I have not had a chance to reach out to yet. So I'm hearing many ideas from where we can move next. The enthusiasm is palpable. I think that we have an opportunity today to have you share some of those ideas and to engage with your non-federal counterparts as we look ahead. If I could have the federal members that are on the call today turn on their cameras at this point, that would be very helpful, those that will be able to participate. And what we're going to do, folks, at this juncture is we're going to have a sort of round robin session today. So I'm going to gear this next point and remind our federal panelists of this, that we have limited time. And I have a very, very tough time keeper in Greg. So what we want to do is really try to, keep your answers brief, keep them, sort of packed with data. We want to make sure that we have as many folks as federal members that want to address the question, that they have the time frame to be able to do that right now. So I know to our folks working the slides that we have these questions, I believe, individually placed on each of the slides. Is that correct? For our participants to see. You have that? Hopefully we do.
Can we go to the next slide, please?
Yeah, there we go. Okay, thank you. So, so with that, what I'd like to do, I see we've got several of our folks joining who are federal members. Thank you very much. This is going to be, again, limited to federal members in the way of these Q&As. But if you all have questions, put them in the chat. We'll be happy to answer. So as we prepare to begin working on an update to the strategy, where do you see the biggest challenges as federal agency members and some of the greatest surprises? While you're thinking about that, from a related standpoint, where do you see the opportunity areas for new actions, as well as emerging policy areas that the councils could consider as they seek to update the strategy? So any thoughts on that from our federal members?
Jonathan, this is Amelia Carricker from NIA. Can you hear me and see me?
I certainly can.
Thank you. Thank you so much. I'm a middle-aged woman wearing glasses with brown hair, with a blue background and a blue dress on. I just want to share, as other people have said, how tremendously rewarding it's been to be involved in this activity. As one of the partners through NIH, the National Institutes of Health, our primary mission is to, turn discovery into health. And a large part of this, as has come through in our discussions and planning activities, has been collecting appropriate data. Unless people are represented in the data that we collect, we cannot adequately serve them. So that is, I think, an opportunity and a challenge for the future.
Excellent. Thank you very much for that. Very grateful. Anyone else have any thoughts?
I actually have something that is related to that. We thought about data for this question as well. So I'm coming from the CDC, and I think one of the surprises for me was that people really do look to the CDC for data. And the challenge for us is to get national level data. We do have some state level data that we use a lot. It's from the Behavioral Risk Factor Surveillance System. And with that, we just get state level data if the states choose to include that caregiving module. And so we are trying to look at some innovative ways to maybe use that data to map it out and get more specific than a state level. So that might be coming. And another thing that we had the opportunity to do was to propose one caregiving question on the National Health Interview Survey, which is a big deal for us because that would be national level data. And we were able to get the question on in 2025. And so we will have to wait a minute for that data to come out, but it will be coming.
Excellent. Let me go first. Thank you so much, Greta, for that. Very insightful. Let me go first to Joan, if I can. Joan Weiss of HRSA.
Thanks, John. So the biggest challenges from HRSA's perspective center around workforce development. As many of you know, there is a significant shortage of healthcare providers, especially those caring for older adults. And especially the need is especially around caregiver education and training. Many caregivers are providing care for individuals who have serious illness and multiple chronic conditions. Also, there are not enough caregivers paid in uncare, and also there are a shortage of direct care providers, certified nursing assistants, as well as community health workers, some of who provide care in long-term care facilities and others in the community. The areas that we see for new actions center upon training on intergenerational aspects of caregiving. What supports are caregivers getting to deal with both the older population and the younger population? And how do they learn to distinguish the two different needs? Thank you.
Excellent question. Before I turn to Carol, thank you so much, Joan. I just wanted to flag that obviously there are some issues that are undercurrents here, and regarding workforce and such. And Joan has been just a wonderful professional offering me guidance. So I deeply appreciate it, Joan. Very eager to work
Thank
with
you, Joan.
on some of these workforce initiatives such as GWEP and others, which are going to be critical moving forward. Carol Cox of the Grandparents Council has been very patiently waiting. So Carol,
I'll
please
be
go
brief.
ahead. And then next we're going to go to Helen Lamont of ASPE.
I
Carol.
will be too brief. So I have two concerns. One is the term caregiver keeps getting changed from family caregiver to caregiver. And I know in my work for ages with caregivers, grandparents, and with family caregivers, that there's a big difference. And I think we need to be very consistent in that we're talking about family caregivers, because some groups will say, I'm not a caregiver, I'm a relative. And there literally is not an understanding that families are also caregivers. And I think that really has to be specified all the time, that just because you're not paid does not mean you're doing caregiving. That's one thing. And then my other concern is how these strategies get implemented and even get recognized and become a concern of, say, the state and local levels. I know, for instance, I mean, it's, I guess, common knowledge, last July in New York, they totally terminated the Grandparent Resource Center, which had been going on for like 25 years at least, closed it. And there wasn't any means of getting it funded again or anything. So how does the state and even the local to AAAs that support caregiving, and they're really critical, get involved in this strategy? That's a concern for me.
Any one of our federal members want to tackle that? Or Greg, actually, you just popped on. Why don't you start?
So Carol, you raise a great question. First of all, on the definition or how we refer to family caregivers, I completely agree with you. When we're talking about family caregiving in this context, it is the informal, unpaid family members, friends, those who are doing the work, but not necessarily getting paid for it. And we've tried to be very consistent in our work and in our messaging regarding the implementation of RAISE and Grandparent Council, RAISE and SGRG acts, that we're consistent in the terminologies that we use. And we will continue to make that a watchword moving forward. We certainly welcome your continued input in that regard. With respect to how the strategy can be used, there was one slide, I think it was one of the ones Jonathan Cotter spoke to, which was the strategy has many audiences and intended uses. And it really is intended to be a tool that could be used by program administrators to generate ideas for how they can build new programs or strengthen existing programs. It can be used by policymakers, by lawmakers at the federal level, at the state level, at the local level, to craft new initiatives, new legislation. And it's definitely intended. I think one of the audiences that we named on that screen is advocates. It can be an incredible tool for advocacy by caregiving coalitions to rally around a specific idea or concept that's articulated in the strategy. And you know, we present a great deal of data to support the recommendations and the ideas that are in there. So there's any number of ways that the strategy and the underlying initial reports to Congress can be used to educate, to inform, as tools for advocacy where it's appropriate, and by those individuals for whom it's appropriate to advocate. So I would encourage the strategy to be looked at in that regard.
Okay.
Yeah.
Thank you very much, Carol. Helen, you've been patiently waiting. Helen is with the Assistant Secretary for Planning and Evaluation at HHS, and has been very helpful to me in my onboarding. So thank you, Helen, and please go ahead.
Thank you so much. And thanks to everyone who went before me, because I feel like you queued up the things I was going to say very well, and I appreciate that. So on the point of data, we could not agree more. And I'll just do a little plug here right now. We really see a gap in data on people with disabilities or people who need support under age 65. We have very broad measures of disability in our large national surveys, but don't have anything specific to people who would need the types of specific supports we're talking about, or long-term care or home and community-based services in that age group. So what we are planning to do at ASPE, and the timing is perfect, is develop a set of questions that could be fielded on a national survey or something like BRFIS to get state level estimates, you know, at some point. That would focus on long-term care needs or needs for long-term services and supports. And we have a webinar on that coming up on Monday, and I'll put that in the chat. And we see that as an opportunity not only to learn about that population, but to learn about the people who provide them support, both paid caregivers and unpaid caregivers, in a similar way that we study those populations among older adults through the National Institute on Aging's large surveys. So definitely agree that we have big gaps in data, particularly among that population and the people that support them. The second thing I wanted to mention was, of course, workforce and the labor economy. Right now, as you know, there's large shortages in the workforce, and that can make accessing long-term services and supports difficult for people. It certainly is impacting the paid workforce, and that in turn impacts the unpaid family caregivers, of course, who are searching for this care for their loved ones. But you know, from a positive perspective, we're also now seeing that employers need to really focus on family caregivers. They see that they need to retain these workers. They see the value of investing in supports for them, in providing care navigation, and in some cases, actually providing services, maybe a small benefit for services, but nonetheless a recognition, flexibility, and services to support caregivers. So I think it's a sort of a unique time to watch how both of those things evolve, and the solutions that both employers come up with, and then that folks come up with in the paid workforce space. And then pulling from all of those, I think we're at also a very unique time because there's political will and recognition of both these workforces and unpaid caregivers through the President's Care EO, of course, and then many states have done state plans on, to the last question, state plans on Alzheimer's disease. That was led by the local chapters of the Alzheimer's Association, but I think at last count, 49 states had plans on Alzheimer's disease. And of course, caregiving is going to be a big part of any of those. And then an increasing number of states, I forget the number off the top of my head, but I'm sure my ACL colleagues will know, have master plans on aging. And so I think we're starting to see the states recognize aging populations and need to unify services and to better support older adults, people with disabilities, family caregivers, and then also the paid workers.
Oh, and thank you. You identified quite a bit of trends, not only workforce, but also the caregiver navigation and the fact that people really need those resources. So that's something we're looking into very closely as well. And regarding my old stomping grounds of Medicaid, and I'll go to Jody on this down the road. But we all realize already, it's no breaking news that the Medicaid programs are under a great deal of strain, particularly in the long-term services and support space. So that's also, I think, a key factor here. I've got right now one more hand raised before we move on, and that is Dr. Melissa Gerald of NIH. And Dr. Gerald, go ahead. Great to see
Hi,
you.
thanks so very much. I just wanted to.
Go ahead. Sorry.
Oh, that's quite all right. Yes, in addition to endorsing everything I've already heard, I just wanted to mention one challenge that's a great challenge to us, at least at National Institutes of Aging and National Institute, on Aging and of Health. And that is developing the successful interventions that we need to help address the needs of caregivers. And that's going to be an ongoing challenge. It's a time-consuming work to be able to do the research and the rigorous research that we need to do in order to make sure that interventions effects can be repeated and they can be scaled up, and we can bring them to other environments and other communities, and that they can work. And so that's going to be an ongoing challenge. So while we recognize the needs for all of these services and supports, developing the interventions that will work is incredibly challenging and time consuming, and we need them faster then we can develop them. Thank you.
Jody, hi, great to see you.
Hey, great to see
Jody, we can't hear you for some reason.
How about now?
Can hear you now. So Jody Sumaraki with the Centers for
Okay.
Medicare and Medicaid Services. Thank you so much. Go ahead.
Yes, thank you. Sorry, I'm at a conference and I'm like in a lobby trying to join you all for just the littlest bit to have this conversation. So I won't speak for a long time, but I did want to echo what I've heard from several of my colleagues across the administration, and just note that, I think I had several points kind of that I thought about talking about during this question, but I think really, to Helen's point about the opportunity and kind of the wind behind our backs, I think a challenge can always be coming up with new initiatives or coming up with something like this national strategy or the Cario, or, all these things that are really trying to do and encourage the development of supports for family caregivers. And, I think we've got a lot of opportunity to do that. And so I think that this plan has really, one of the surprises for me has been how this plan, in conjunction with all of those other pieces, has been able to kind of inspire a lot of thought and recognition for family caregivers, and has really kind of helped people at the federal level think about their work and their ongoing work and how we can do little things even within ongoing programs that can make a difference. And I've been able to notice some of those things coming up in additional initiatives that have been discussed at my agency, and I think, in other agencies. And I think some of those things wouldn't maybe have been considered before had we not had the momentum of the national strategy and other opportunities that have come along with the administration. So I know I missed a ton of the conversation before this, but I just wanted to say that I think that the strategy really has pushed and gotten this on people's radars, and I hope that we can continue to make gains in that, and that people will continue to see additional strategies and supports and things that we'll be doing that will be included in future iterations of the strategy that we've been able to do
since this came out in 2022.
Excellent, Jody. And we really count on CMS as being a strategic partner here, and look forward to our continued work with you and the agency. I think we can move on to question 2. So let's go ahead with that. So on a related note, for question 1, if we still remember question 1, do you have a sense for, or are you able to talk about what your agency might be able to put forward as new actions in the first update to the strategy? Let me begin with Greg.
So yeah, so this is one of those areas that I think has been particularly one of those unexpected outcomes of the strategy that, you know, even as the agency and as the individual who has pretty much led ACL's effort to implement the requirements of the RAISE Act, I didn't see coming. So for example, when the strategy came out, it created this opportunity for ACL to look at our appropriation for the National Family Caregiver Support Program in 2023, which saw a nice increase. And we had this opportunity to then exercise discretionary authority within the National Family Caregiver Support Program to do projects of national significance. And so that's when last year, when we launched the National Caregiver Support Collaborative to support our aging services and tribal services networks to implement and build on the principles that are in the strategy to improve the programs and services that are part of the National Family Caregiver Support Program. That's why that's going to be one of the new actions that the additional actions that we report on, because it wasn't on our radar screen. Fast forward to our fiscal year 2024 appropriations, when, you know, and if you track the appropriations process, we got our final budget somewhere, you know, in April-ish, and within that was a mandate from Congress that they appropriated $2 million specifically for developing and testing approaches for implementing what's in the national strategy to support family caregivers. That's not even in our new actions that we're going to be reporting on because it's so brand new. And we just released the funding opportunity announcement for that late last week. And so it's this constant role of new opportunities that come up that we're ever alerted to. And I think that will be one of the things that for ACL, and at least for the Administration on Aging, one of those things that we look forward to as we begin to think about what our contributions to an updated strategy will be, is what opportunities do we think may be present, you know, to build on what we've just started or build on some of those additional actions that we launched since the strategy came out.
Thank you, Greg. Jody, CMS.
I'm checking. Am I good?
You're good. You're great. Yep.
Okay. Okay. So, you know, it's been another exciting thing for us, I think, to my, point that I was making earlier. I mean, the thing that's so nice about this strategy is that it's iterative. You know, it's not something that's stagnant that just got put out, several years ago and that's it. So, it'll continue to evolve and it'll continue to inspire and it'll continue to, help keep things on our radar so that we continue to think about new ideas and initiatives. And for us, we've actually already submitted multiple new actions that were included in the original strategy that went out in 2022, and that hopefully will be part of the new version that comes out when that does. And, we're always playing catch up. There are just some things that, you don't think about, to Greg's point, or you don't know even existed until a new opportunity comes along. And so, a couple of the things that have happened since the strategy came out with our contributions to the federal actions portion, were like the CMS Innovation Center announced the new Guiding and Improved Dementia Experience model, or the GAD model. I mean, that wasn't even, it may have been on somebody's radar when we were gathering our ideas, but, it certainly didn't make it into the initial strategy, and that's a super exciting opportunity that we have now. So we'll be highlighting that in a future version. We also had our Medicare colleagues issued the final rule in 2024 for the physician fee schedule. And, you know, those had that there were policy changes there for Medicare payments that became effective on or after January 1st of this year, to where, you know, Medicare can now pay for certain types of practitioners to train caregivers to support people with certain diseases or illnesses in carrying out a treatment plan. I mean, there are just things like that that continue to evolve that I think once people continue to learn about the strategy and what we're trying to capture here, that it will continue to kind of spur more ideas and more thoughts and more communication. Because, you know, a lot of these agencies that you have are really big, you know, and you have one person in each of these organizations kind of trying to gather every single thing their whole agency is doing. And that in itself is a challenge, because I might, you know, not everyone at CMS might not know that I'm one of the main people that collects these actions, right? So it's all kind of a learning experience for us, I think, at the federal level, and one that we'll continue to work with you all on and with each other and with the council. So just wanted to kind of raise a couple of good things that have happened for us since the strategy came out that you all will see in future iterations.
Jody, thank you so much. Much appreciated. Liliana Chakrabarty of ACF.
Hi, everyone. Yes, Liliana. I'm a child welfare program specialist in our Children's Bureau within the Administration for Children and Families, and just wanted to give you a few updates, not necessarily new actions, but as we were saying, like ongoing work. I heard a little bit talk about evidence and research. And so the Administration for Children and Families, based on a new child welfare law that passed just around 5 years ago, there is funding for kinship navigator programs that meet certain evidence-based requirements. And we're pleased to know that we now have 5 programs that have met the evidence standards by our Title IV Prevention Services Clearinghouse. And so we now have 4 states that are taking this option for ongoing federal funding to implement those programs. And I'll be able to put a link into the chat around these kinship navigator programs. In the previous question, you were asking about challenges. One of the programs that we work with is our Title IV-B funding that goes to all of the state child welfare agencies and the tribal Title IV-E agencies to help them to develop a kinship navigator program, with the hope that some of those will be able to meet those evaluation evidence requirements. One challenge we ran into is that this last year, Congress cut the amount that was given to all states. So we used to have $20 million for funding, and Congress decided to make that now $10 million. So we just issued the new program instruction. The states are in the process of applying for that new funding for the next year. And I can drop that information in the chat as well. You can see the amount that your state child welfare agency would be receiving. Many of the states work with their community-based agency partners, making sure that they're working with community-based agencies who can help to implement these programs, especially for those informal kinship caregivers, those grandparents that are taking care of children outside of the child welfare system. So we've given them the flexibility of working either with children in foster care or children outside of foster care. And through the various different discretionary grants that we have, one of the projects that we funded recently created a national training and development curriculum that is online, and it's free, and it's for any foster parent, adoptive parent, or a kinship caregiver. And it has a whole section around family dynamics and learning more about kinship caregivers. So we have a lot of different resources. We're working jointly with our colleagues at Administration for Community Living on hopefully some new guidance that we'll be able to put out soon that kind of references all of the different federal programs that are available for grandparents or kinship caregivers. Thank you.
Thank you, Liliana. We look forward to that. Joan Weiss of HRSA. Joan, you're on mute. Sorry.
Thanks, John. So this is kind of a continuing activity, but it's a new activity. So our 2019 cohort of geriatric workforce enhancement program grant recipients, WEP recipients, ends on June 30th, 2024. And we had a competition this year for a new cohort. So some of the grant recipients will be the same, others will drop off, and we'll have new ones that replace them. But I just wanted to state that in the new NOFO, we used language specifically around the supportive care workforce, caregiver workforce, so that we specifically called them out. And this program develops a healthcare workforce, including the supportive care workforce, to maximize patient and family engagement, to improve health and health outcomes for older adults by integrating geriatrics and primary care. So that's one thing that's kind of continuing, but has more visible language. And then our programs are committed to caring for training caregivers to provide dementia care. Specifically, we have devoted, we ask that each grant recipient spend $230,000 each year for 5 years on dementia trainings, including caregiver training on dementia. And I think that's it for that program. And of course, we train other sectors, other disciplines through this program also. The other thing that we have that's continuing, and that I'm like really proud of, is that we were able to have a caregiver representative on our advisory committee on interdisciplinary community-based linkages. And this is a advisory committee that reports to the HHS Secretary and Congress on programs related to primary care, geriatrics, and mental and behavioral health. So that's continuing. That member is coming off in a few months, and we are replacing her with another caregiver. So thank you.
Thank you. Another opportunity to engage from the caregiving aspect.
Yes.
SJ Glynn, great to see you from the Department of Labor.
Thank you, John. And thanks for the opportunity to speak. I want to update a couple of things that are continuing actions, but new particulars that we're focused on at DOL. I think there's two big buckets that we can put our work into. The first is thinking about people who are providing unpaid family care who are also employed, because our focus is always on workers at the Department of Labor, and how we can best be supporting people who have those family caregiving responsibilities that sometimes can be in conflict with paid employment. And paid family and medical leave is a big component of that. We are absolutely going to be continuing all our work in that space, providing technical assistance and research around the existence of the current 13 state paid family and medical leave programs, and development around federal proposals as well. As part of that work, on the 26th, our Women's Bureau is hosting a conference. There is a virtual option. If folks are interested, I can put the link for registration into the chat for people. But that's bringing together researchers and state administrators in order to talk about equity and implementation. And so we're beefing up our work directly with the state administrators of those programs. We have some research that'll be coming out and some other things planned throughout the rest of this year, because we know that's such an important support for folks who are caregiving, in addition to whatever their paid employment responsibilities are as well. And then in the second bucket of thinking about folks who are employed as paid caregivers, we have a bunch of research that'll be coming out in the late summer, early fall, specifically thinking about wages for care workers, but also looking sort of at the tightness of the overall labor market and how that's presenting problems right now around recruitment. We have a very strong economy at this moment, and that's creating some challenges when it comes to finding folks who can work as paid caregivers. And I think that there's a few other pieces of that too that I'm happy to talk about more that kind of fall into the more research and data bucket that so many other folks have already mentioned as we've had this conversation thus far. But I think there's a lot of exciting work that we're very interested in continuing to dig into and work in partnership with all of our friends who are on this call today to think about how Department of Labor can be using sort of our vantage point and our view onto these issues in a way that's really complementary to all of the other work that's happening across the federal government. So thank you.
SJ, thank you very much. Really appreciate it. Before we move on to question 3, I just wanted to say that the next 3 questions have a real key theme to them. And I think you see this already from the discussion thus far. It's not just about the raise strategy or the grandparent strategy. It's about all these different emerging trends and how the agencies are very quick to adapt and modify to sort of recognize some of these emerging trends and what transpires as a result. So let's go, if we can, to question 3. Thank you very much. Here's another one. How do you feel we can maximize coordination between agencies for dialogue, learning from one another, and synthesizing of communications? So not just internal, but also media releases as well. Greg.
So I just wanted to build on this question and remind our federal partners that one of the mandates within the RAISE Act, one of the expectations is that as a result of the development of the Family Caregiving Advisory Council and also the Advisory Council to support grandparents raising grandchildren, that one of the underlying intents of that is to foster greater communication and collaboration among the federal agencies. And I think that over the past 4 years, that has been one of the most exciting things that I have seen in my 18 years of federal service, is the improvement, the strengthening of the growth in the dialogue among us, the connections that we have been able to make to share ideas, to cross-pollinate on program development and that nature. So we've definitely laid good groundwork. Where can we go next with this? And how can we strengthen it and make it even better? So that's where we want to go with this conversation next.
Thank you. Just one thing I would add is, think about, to our federal members, think about perhaps different agencies that you've strengthened and maximized coordination with. Are there best case practices there that can be applied to HHS or our work with, or your work, I should say, with ACL? So that would just be an asterisk I would add there. And speaking of a very dynamic agency in this arena, I see we've got Meg Cabot with us today. Great to see you, Meg, from the Veterans Administration. And please proceed with your question, or your feedback, I should say.
All right. Well, thank you very much. Can you hear me okay?
Yes, perfectly.
Good. Excellent. Okay. So a couple of thoughts on this. I think VA is so often treated as or not treated, that's a loaded word, sort of perceived as being sort of separate and distinct in the services that we provide to caregivers of veterans. And yet, obviously, as a colleague at the White House often says to me, veterans are people too. And so our caregivers often take advantage of all of the services that other agencies provide as well. And I would love for us to see, Greg and I have known each other for quite some time now, and I do think we've made some progress in collaborating, but I know that one of the key things that I hear from caregivers, especially in the aging population, is this notion of coordinating all of the different kinds of resources that they have available to them. It's challenging to coordinate everything within VA, but then you add on top of that the services that they could be receiving through Medicare or through a local agency or a nonprofit, as well as, some of them are eligible for some services through DoD as well. So I would love to see us get kind of go well beyond media releases and actually get into the weeds around coordinating benefits to include VA and DoD. I think that could just go an awful long way. And I do think it would help if we start looking really at the coordination of benefits beyond just Medicare and Medicaid. I really do think we're gonna be able to support veterans even beyond caregivers even beyond the veteran space, because I think it'll lead to some innovation in other areas as well. Oh, John.
I got it. Thank you very much, Meg. Really appreciate your comments there. We look forward to working with you to see how we can strengthen our relationship and related agencies, frankly, moving forward in this space. Jody Sumaraki of CMS.
Yeah, sorry. I wondered whether we might consider, I mean, speaking of, some of the practices we are involved with our federal partners and good partnerships that we've had. I mean, we have multiple meetings with ACL and our group at CMS to discuss any number of issues. And it's really led to a strong partnership on many levels. And, I wonder whether there's any wisdom in having, or maybe trying to pull together, at least on occasion, a separate meeting just for the federal partners to actually collaborate on these issues. I mean, I know there are probably other meetings that we could be doing that at. I'm not really sure, but it might be worth a thought of, once in a while pulling together the leads and maybe even others who don't typically attend these meetings to say, like, how can we work together and do some larger thinking from the federal perspective on how we continue to shape and think about our ideas and how they relate to and fit within future, the current version of the strategy and future versions of the strategy as it evolves. So just an idea to think about in terms of whether we should, be getting together in a separate venue once in a while, just as agencies to kind of think about how we could work together.
Greg, thank you, Jody. Appreciate it. Greg, you want to respond?
Yes, before we go to Carmen, I want to build on what Jody was saying. That's an excellent idea. And as the agency charged with leading the implementation of RAISE, one of the big goals that I have had is to be able to pull our federal partners together. And that, because of simple bandwidth issues, hasn't been possible until now. As I had said earlier, Lori has been my amazing partner in crime in this entire endeavor, and we're spread pretty thin. But now I've been able to bring Jonathan on and a couple of other folks, and we're going to begin to formulate with our federal partners, how can we meet on a regular basis across all of these issues to look for ways that we can collaborate across programs and program areas and develop cross initiatives. So that is very much on my radar screen. So to all of the federal partners, stay tuned, because that will be something that we're looking at. Carmen.
Hi, I'm Carmen Sanchez, and I'm with the U.S. Department of Education, along with my colleague on this call, Tammy Proctor. And we really see our role as amplifying the messages and getting it to families. We fund discretionary funds that are centered around family engagement. And many times those centers and those program projects are looking for ways of letting families know about the entirety of what might be available to support them. We have some family centers specifically for families of children with disabilities, and it's when the child is in school that they start thinking about, further thinking about caregiving issues and the long-term, how caregiving can happen once the child is now an adult and leaves the school system. We also have some projects that are specifically focused on grandparents of children with disabilities, and also projects in some states that focus specifically on helping grandparents. So really, we see our role as to be good partners in getting the information out from what's available throughout the federal agencies to families more directly through our projects. So we would welcome any opportunity to learn more, to amplify a message. And I love this idea of us getting together quarterly so that we're all on the same page and we can have it rise to the top of our minds in terms of what we want to get out to our constituents. Thank you.
Thank you all for that excellent feedback. Greta Kilmer.
Yes, I just wanted to let you know that myself and also I have a colleague, Akila Ali, who would be happy to be included in any networking that you do with federal partners. And also, I'm glad that Greg had mentioned the media releases because we do plan to have some research coming out, and it hasn't been cleared and everything like that, so I can't tell you what the topics are, but our media and communications people are coming up with some toolkits and things that we would normally share with some of our partners, like in nonprofit and things like that. But now we're realizing that we should probably be also sharing them with all of these federal partners here in this group. So thank you for bringing that up.
Thank you. And when I take a look at the CDC, I think we're all perhaps more sensitive than ever post-COVID about public health, and particularly in this context, how public health would affect someone who is a caregiver for someone who has a disability or someone who is aging. So that's really very, very intriguing at this point. Look forward to that. And thank you all for your very constructive comments on more coordination. Seeing no questions, I would like to go along with our emerging trends theme and discuss emerging trends in the long-term services and supports arena. So for the panel and others on the council, what are the greatest opportunities to better meet the long-term services and supports needs of older adults and people with disabilities, as well as their caregivers in the next decade? And if that question was not loaded enough, an addenda is similarly, how can the council's collaborative work be used to focus more attention on these emerging trends? So I know a lot of our agencies are very, very focused on particularly emerging trends on how we're going to be providing this care. So let's start with Jolie Crowder of the Indian Health Service for her thoughts on these matters. Thank you, Jolie.
Thank you so much. And I know that it's covered kind of in the report that's coming up, and it was in the original strategy, but prior to coming to IHS and working with tribal communities, the number one thing I heard over and over again was respite care, figuring that out.
Jolie?
Yeah.
We're having some trouble understanding you. Can you?
Okay, let me lean in. Yeah, sorry. I'm a little
Jolie, I'm sorry. I think what we're going to do, Jolie, is come back to you, maybe see if you can maybe restart a computer or log on, log off somehow. That would be very good, okay? Because we're having trouble understanding you, like you're underwater. But we want to hear from you. So if you can solve that tech issue, great. Let's go to, I believe Jody Sumeraki was first, and if I'm not, Joan, forgive me. So Jody, go right ahead.
Yes, and I was going to say, Jolie, maybe she could put her camera off, and that would probably solve it for her. Yeah. When you asked the question and you gave the list of the emerging trends, I mean, I kind of made some notes to myself earlier and just kind of said all of the above. I mean, these are all areas of concern, and another, in terms of just overarching challenges that I think, we're all trying to grapple with, even just, at a super macro level, is really just what are the long-term care options in this country? What, are they adequate? I mean, do we need to be thinking about other options, other viable options for people other than trying to, in addition to trying to, continually build enough workforce to provide the care in various settings that people need now? Like, what are the other options that we can look at that we can try to, whether they be new, whether that be something that comes from, new laws, or something to really give some additional options that don't basically, make people spend down to poverty level to get services. Like, how do we kind of look at that and have different options? So I hope that we can kind of have some more of those conversations at some point too, maybe not as part of this group, but I mean, when you talk about like other larger trends, it's another thing that's always in the back of my mind as a problem to solve. But it takes a lot of people to solve that problem. So I just kind of wanted to put that as another idea, as something kind of macro level that is a concern.
Jody, and before we move on to John, I just wanted to react to that. It's all, I think, more or less a triumph by incrementalism right now. And I'm saying this as somebody who worked for many, many years on these macro long-term care financing efforts, trying to get them through Congress and that sort of thing. So that was in my previous life. And I'm just curious, and maybe I can ask this of CMS, is, what do you feel is in our power at this point from an incremental standpoint to maybe focus on when you talk about reforming our long-term services and support system? Is there something that is in our power to do that's enacted somehow that perhaps we're missing? And you can think on that, but that is something I just wanted to react to on that.
Yeah, no, for sure. I mean, and I think we're trying to, like, as you said, do incremental things. There's so much that's in the new access rule that just kind of came out through a bias that, we're really trying to look at the quality of the services that we're providing, making sure that people are getting the services they're assessed to need. I mean, there are so many different things that if we do a better job at that, it can shore up a lot of things. But I just think, it's just such a big issue that I think it's continuing to hold together the system we have. But I just don't know if long term, it just seems like there should be some additional options for people. So I mean, I think I worked with you a little bit in your old hat days, and it's hard to not kind of recall some of those conversations and wonder whether we'll find ourselves, in a similar situation with future opportunity, because I think a lot of the times people say, we're holding the system together with Band-Aids. And, I hope that we'll continue to do it, but I just hope that we can come up with some other options too.
Well, this gets back to our previous discussion about workforce and other trends that are probably going to be dictating where we go from here, some of these very, very strong trends. And Joan, before I get to you, speaking of workforce, we'll put a pin on that for a moment. Jolie, I'm going to come back to you. I have very limited technical knowledge, but maybe if you closed off your camera, maybe we'd be able to hear you this time, because I would love for you to weigh in from the.
I switched to a new headset. How's this? Is this any better?
Yeah, that's a lot better. You're no longer underwater, which is great. Thank you.
I'm so sorry. I'm very hoarse from allergies too. So I feel like I'm screaming at the microphones. I was just saying, before I came to IHS 2 years ago, the number one issue that I heard when we talked to tribal elder services providers, caregivers, and older adults is respite care. We tried to do some grants. We tried to connect people with services, and it is complex, long, and problematic. But it is the number one need, I think, that we hear over and over again. We have some grantees now who are trying to navigate their way in their local communities and help fill in gaps in the respite care system, but they're dealing with Medicare, Medicaid, veterans benefits, back to that comment earlier, trying to figure it out. But that piece, respite care, I think is the biggest issue that we're hearing. Probably the hardest and most complex too, because there's so many payment providers. I do know things like the guide model are trying to step in and offer some respite care benefits through Medicare. At the end of the day, having had a family member who needed respite care and getting it through the state system, I think they got like $1,000 benefit. It wasn't nearly enough to truly provide the type of respite care that we needed, particularly in a timely way and in the amount and volume that we needed. So if I would say there was one big opportunity based on what we hear in the communities, I would say that is where I'd put my money.
Thank you, Jolie. It's a major issue across the board, and we look forward to working with you on that. Respite, of course, requires a workforce. It's a workforce matter. It's a workforce initiative, as so many are. So we go back to Joan Weiss over at HRSA. I assume to weigh in regarding workforce and education and retraining and all those good things. Joan, any thoughts and your thoughts moving forward on that?
Thanks, John. So first of all, there is not enough information available for caregivers and family members about how to access supports and services. So a lot of training needs to be done there. Second, we're concerned about how nursing homes are going to meet the staff ratios. We are committed to training the workforce. We have it in our 2024 GWEP as a requirement that our grant recipients participate with schools of nursing to develop curricula and teach nurses on how to care for older adults, especially in long-term settings, and to give them a clinical experience in long-term settings with the goal to really help them see how great it is to take care of older adults and to eventually to work in nursing homes. There is a shortage of direct care providers, and we're trying to meet this in nursing homes by providing direct care workers, CNAs, and community health workers with career advancement training. Nursing facilities are closing. This seems to be accelerating, and that's a concern. Overall retraining and retention of workers in long-term care. This is very much of a concern, especially in rural and underserved areas. So these are the things that we're working on, and these are the things that give us pause. And we would like to engage the council if they have any thoughts.
Thank you very much. I do not see any further questions before we move on, but I do want to flag Joan's challenge and see if there's any reaction to her thoughts from the council, at least at this point. Just given how workforce is so interrelated across the board, as we've heard. Well, it's certainly something for us to think about, Joan, and perhaps punt to a meeting where we can all get together and see how we can better coordinate and see what the potential is moving forward. So thank you for that. Moving on to our final question, question 5 for the panel here. As currently stated in the strategy and during the council's work in subcommittees over the past several months, the idea of developing a centralized, federally supported navigation portal website showcasing services the federal government provides has arisen several times. From your respective vantage points in your agencies, what could such a resource look like? We will start with, well, this was simultaneous, never had that before. Let's start with Tammy Proctor. Tammy?
Hi, Tammy Proctor from the Department of Education, along with my colleague Carmen Sanchez. This idea, as we were having these council meetings, I agree, it did come up several times, and it was very exciting to hear the idea of that. But when you think about that, the load of a centralized portal, would require a lot from several agencies. At the Department of Education, we're committed to supporting and sharing information and supporting families. And we currently have a resource clearinghouse that we put together during the COVID time that provides information not only just to families, but also to professionals and also to teachers from the education perspective. And so when I think about this, portal, I think the portal could probably be, it would be huge. It would need to be broken down geographically. Also, so when a family was searching, that they could kind of zone into their region and the services that were available closest to them. So I see it being, I guess, divided out by topics and also services, and then broken down geographically, which is done a lot of times with at the HHS with some of their child care centers and child care services. They break those down regionally. We do those regionally with our parent centers. And so I think it's a great idea. I think it's a huge lift. It's a commitment that all agencies that are pouring into this portal would need to continue to feed into that, update, make changes, and manage that. The idea is great. I think the idea would serve families well, but thinking of the reality of the manpower that would go into that. So when I think about it, we might think about approaching it from our agencies committing to taking the information that is coming out of the council and that needs to be shared, committing to sharing that information through their respective programs, their respective grants, and any of their current media or resource portals that they may already have. And so those are my thoughts, but I think it's great. I think that is something that the Department of Education could lean into and support, but we have to really continue to think about what happens once you gather all the information, what's required to go back to make sure that the information remains current, because nothing is worse than a family searching for a resource and it's not current, or they can't find it in their region or in their neighborhood, and they see it in another neighborhood or another region. So I think it's a great idea, but we need to think through how we might approach some of those challenges that might come with a nationally federal portal with several agencies pouring into it.
Thank you, Tammy. I think this is one of the reasons why we have federal members, is to really weigh in with this and work with us on best case practices. So we really appreciate that feedback. Okay, I think then we go to, this is a very, very popular question 5. Let's go to Jody Sumaraki of the Centers for Medicare and Medicaid Services. Jody.
Yeah, I would just piggyback on what my colleague just shared. I mean, as someone who, like many of the people on this call, have been in a situation where they were looking for those sorts of services for their family members, even someone that works for the federal government who, kind of gets on it and is a little bit savvy and is like, well, I'll look at longtermcare.gov, or, you start to kind of like think about these ideas, and that actually used to exist and used to be a page that existed, but I don't think it does anymore. But I thought, gosh, wouldn't it be such a great opportunity to have something like longtermcare.gov, where you could go and it would be a clearinghouse or a dashboard of all of the services that people needed or could access in their state. But to the points that people have made, I mean, it would just be such an astronomical thing to undertake. And that's not to say it shouldn't be considered, because I think it would just be a remarkable help to so many people to have that. But again, to be able to gather all of that information and to make sure it's current, and it would need to be not only geographical, but I mean, state by state. Like if I'm in Virginia, I need to be able to look up with the services in my state, in my county. I mean, you need to be able to drill down into those things. And, is it a website that then sends you to a bunch of other websites? Because then people are going to be like, oh, I don't want to go to 7 different websites.
Right.
So it's not even like but here's the education's website, and here's CMS's website, and here's this other website. It's like, how do we get something that is a cohesive picture of everything an individual could be eligible for in one place? And how we would do it, you'd have to hire like Microsoft I have no idea. I mean, you know, somebody huge who can do these things, you know, to do it and do it right. But, you know, it's just going to take such commitment from so many people to get that done. And, but if it's going to be done, it shouldn't be done a bunch of different times in a small scale. It's like, what do they say? Like, they go big or go home. Like, do the big things so that people can go on and find what they need, and just commit that it's going to take a huge team of people that work on that full time. You know, so it would take a lot, but I think if we were going to do it, it just needs to be comprehensive, so that people can find those resources and not go a bunch of different places.
Thank you, Jody. Very helpful. Before I move on to Helen and Joan, I think that's the cue I think that we're going to go with. I just wanted to insert here a comment from our co-chair, Carol Zernial, who said the general public is very interested in a caregiving.gov type website. Even professionals have no idea how many federal agencies have programs that benefit caregivers. Carol's recommendation is this might be an area where AI could help to glean the information across agencies. So that sentiment really holds, that people just, as many of the federal members and I have discussed, they get lost. They don't know what to do, where to go. If I had a parent right now who presented with an illness, I'd be in the same boat. So I think that sort of moves this forward. Helen of ASPE, let's move to you first, and we're going to go to Joan and get your thoughts on this question.
Great, thanks. Thanks so much. And I'm so glad someone from the Department of Education spoke up first on this question, because at first my impression was, gosh, well, we have the Elder Care Locator. ACL has funding for programs that are supposed to be doing this. And maybe the challenge is that people don't know about them. They're not, you know, out there enough or not comprehensive. And then I was thinking about this from the, you know, education perspective, or if you were a parent of a child with a disability that needed supports, you might not go to caregiving.gov. You might not go to something on disabilities if they have a learning difference. You might go on the opposite end. You might go to alzheimer's.gov if you've got a family or loved one who's got Alzheimer's, and look for resources there. So I recognize this sentiment, but I think, and this was a very early conversation in the RAISE Council's work, getting people to recognize that they are caregivers and what to look for is also a challenge. So I would say anything that attempts to fill this gap should be very thoughtful and do a lot of work on what the best way to bring things together and to be sure that we're not duplicating with all different websites, but also recognize that people identify very differently what they're looking for based on who they are, the type of care that they're providing, and the characteristics of the person that they're assisting. And that might change how they go out to look for resources. And so we would want to make sure that whatever we design recognizes all of those things.
Very a lot of wisdom there. Thank you very much, Helen. Moving on to Joan Weiss of HRSA. Joan, your thoughts.
Thanks, John. I agree with what everyone said before me. And just to build upon what Jody said, I think it would be a good idea to have state profiles of available and existing services and where and how to get those services. And then I think to add to the complexity of the discussion, perhaps a portion of the website could be devoted to where patients and caregivers could ask questions. And then maybe another portion where, if it's just a federal website, where additional resources can be added when they become available or updated. And I'm assuming there would have to be some kind of clearing process before things could be put on their website. But either just making sure, as it was mentioned before, everything is current. Thank you.
No, thank you very much. Any other questions from our group? I see we've got Meg Cabot from the VA. Great to see you, Meg, again. And What are your thoughts on question 5?
Yeah, I agree with everything that all my colleagues have said before. And you know, I think one of the challenges here is what we put on it, right? I mean, there's the resources, right? The actual programs and services that could be available to caregivers at the federal level, the state level, the local level, all of those kinds of things. But then there's also the sort of what you're eligible for. And this, I think, is one of the big challenges as well. So, you know, and these things are not easy. It sounds always so great to figure out some sort of a portal, and it's a very complicated process, right? And you know, we talk about this even in within VA, within our agency, is why can't you just, you know, put in your information and up pops all of the VA things that you're eligible for? Well, it's just not that simple. But I feel like that's part of the challenge, and part of what certainly the caregivers I work with would want out of a portal or a website. So it's not, I think there's two different concepts here. This notion of the actual services and resources that are available. There's so much information on the web about all kinds of different topics, and all different kinds of disease process, injuries, all those kinds of things. But then there's also this issue of what an individual family member is eligible for, of what that family caregiver is eligible for. So I think that would be a key piece of figuring this all out, is how we address that, those two different pieces. So just wanted to add that in. Thanks.
Thank you, Meg, for that. We've got one more query here from Carmen Sanchez, and that'll be the last one because I want to stay true to our timing of the agenda. So Carmen of the Department of Education.
Well, thank you. I'll try to be as brief as possible, but this conversation is also raising for me issues about the kind of energy caregivers have to find these resources. And sometimes seeing them on the webpage isn't enough. Sometimes we find that it's more helpful for them to have somebody help them navigate those resources, give them some sort of one-on-one support. So I'm not sure whether or not we'd be able to do that, but also thinking about the ways in which we can support caregivers in terms of sorting through the resources and sorting through what might be available to them.
Great. Thank you very much for that. I also wanted to mention that joining us on the call today is Rosemary Payne of the Substance Abuse and Mental Health Services Administration. And we all know their vital role in all of this, given the addictive disorder issues that the country is facing. And Rosemary invited me to give you all her email address, which I can follow up with following this segment in the chat. It's Rosemary Payne. It's rosemary.payne@samhsa.hhs.gov. So if you have any questions on substance abuse or mental health, we invite you to email Rosemary directly. So with that, I do want to thank our panel today. We will certainly be in touch and find new and more comprehensive ways of communicating, more pragmatic ways of communicating with all of you. But again, I'm very grateful to those who joined us today for their wisdom and also for our one-on-one calls over the past several weeks. What I'd like to do now is move to the next segment, and that would be Carol Zernial. Carol, we certainly want to encourage you to have any of the non-federal colleagues react, respond, and pose questions and ideas regarding some of the content that just came up. So with that, Carol, the floor is yours, and I thank you all. So great meeting so many of you. Carol.
Thank you, Jonathan. Thank you. Well, I'd like to take a moment for the non-federal partners, for those members of the council, to maybe react, ask questions to what you just heard from the federal partners. That was a lot of information, a lot of ideas. So I know I'll even kick off. I'll ask a question. You know, listening to you, and I've been on other webinars where federal partners are talking about caregiver programs. How do we ensure that all that wonderful expertise across the federal agencies gets baked into what we're doing. So I feel like there's a time gap where the councils are meeting, federal agencies are planning, information is available, but I know that I have heard things on webinars from federal partners that I thought, wow, I wish I had known that when we were discussing it as a council member. Maybe there's not an answer to that, but I certainly don't want to lose that information coming to us, the non-federal council members. Stump the panel. Well, that's my thought. Does anybody else have something that they would like to share or a question they would like to ask of our federal partners? Jennifer.
Thanks. I had a question for Helen Lamont. It just strikes me that the NAPA strategy for Alzheimer's and dementia has been tremendously successful in bringing together federal stakeholders over the last more than a decade. And I'm wondering if there are lessons learned in how to make progress in bringing together the various stakeholders, because this is clearly a multi-sector issue. Family caregiving touches all aspects of family life, care delivery, the workplace. So anyway, that was the question that I had.
Is Helen still on to be able to respond to that?
It looks like we may have lost her.
It looks like we may have lost her. So we'll try to get that answer for you, Jennifer.
Yes, I think that she had to leave a little early to go to another meeting, but the transcript should capture that, and we will certainly follow up. Thank you very much.
Thank you. Does anybody else have a question for the federal partners? So
this is great. I just can't, I've sat in all of your subcommittee meetings, and I can't believe that our non-federal members don't have, oh, there's Jonathan Cotter. I knew somebody would have a question for one of us, any of us.
Not really a question, but just more of just an excitement and a comment that for me, this has really been just a wonderful experience to learn about all the different federal partners, because I came into these kinds of conversations really honestly thinking about the centers of Medicare and Medicaid primarily. And this has really opened up my view of all of the work that's being done across the federal partners with Department of Labor and CDC and so many other ones that that's what I'm taking away and trying to integrate into our organization for implementation too. So this has just been fantastic. Appreciate it.
Thank you, Jonathan. Is SJ Glenn still on? Because I had a question about the conference that she was talking about. I don't think I saw the information on the conference go into the chat.
Oh, I thought I pasted it in there, Carol.
Did you? And I missed it.
Yeah, I can make sure. I'll send it to you directly as well to make sure you have it.
Thank you. Thank you. Sorry that I missed that. Joan. Ooh, and we can't hear you.
I'm sorry. I think I hit the button accidentally. My apologies.
No problem.
Wait, hold on. How do I look? There we go.
All right, Denise.
I was just wondering for our federal partners, especially like CMS, how as advocates can we help you get Congress to understand that if you can't have continued yearly increases in your funding so that you can increase the reimbursement rates for our long-term services, we're going to be in an even worse crisis than we are right now.
Would anybody like to respond to that on the federal side? It's a big question.
This is Greg. I think Jody may have had to drop because I know she's at a conference. I can speak. That's a great question, Denise. And it's a difficult one for me as a federal employee to give you a direct answer on. But what I can say is that, you know, there is, through the work that we have done, through the work that the previous advisory council has done, through this report that's coming out that will show the federal progress on what we have accomplished with the resources that we do have. Folks have an incredible opportunity and a resource there to educate policymakers and appropriators about the importance of this issue and what it means to continue the support, to grow the support. It's really a matter of how we take the data, how you all take the data, the information that's there, and package in a way to tell a compelling story for why legislators at any level, whether it's the state, federal, community, local, it doesn't matter. You know, how they can use that information to make decisions about the types of programs and supports they fund, no matter what they are. That's probably the best answer I can give you without digging myself too far into a hole.
Thank you, Greg. I thought I saw someone else that I missed. Oh, it was Nancy. Nancy.
Thank you, Carol. Yeah, this is Nancy. I am going back to what Carmen said a little bit ago in talking about the pros and cons of the idea of a portal. And Carmen, you really resonated with me on that. I think as a society, we're getting further and further away from human contact and relying more and more on technology and research online and so forth and so on. And so it got me back to thinking about all the times through our discussions where we've talked about navigators, where there could be an individual, whether it be at the state level or your regional local level, or even representing the national level, but just someone people who would be highly knowledgeable about various systems and what might be available in a particular region. So I kind of keep going back to that, thinking I'd rather talk to somebody on the phone who's going to hear our situation and then guide me rather than have to fish through, you know, a million possibilities on a portal. And then that also leads to something that we've touched on a little bit in past meetings, and that is the value of families connecting with other families. In our case, the very best learning that happened for us when our son was little, who's now 30 and has intellectual disability, was learning from other families, hearing their stories, hearing what worked, what didn't work, especially in your local communities. So I just wanted to share that little perspective. Thanks, Carol.
No, thank you, Nancy. You know, I love what you talked about, combining the navigators, real people, with the technology. So it's not all technology is not the answer. We can't scale if it's all people, but using that combination of a navigator who knows how to use these systems that we build, you know, is a really great interim step. So thank you for mentioning that. Keith.
Thank you very much. I appreciate that, Carol. For those of us on the SGRG and everyone that's raising a grandchild or a kinship or whatever relative you may be raising, the elephant in the room, and I know there's probably not a direct answer to this, but at what time and what place and time do you think it will be before the informal and the formal are treated the same? I mean, you know, there are some states that are doing it, but there are by far the many that are not. But do you think there will ever come a time that we'll be on the same wavelength with each other?
That's a great question, Keith. I'm going to one-up you on that one and say, when will they be treated the same? And can we raise that up a level? Can they both be treated the same with more respect, you know, more pay, more recognition, all of the above? So thank you for that question. Lynn.
Thank you very much.
Yes, thank you.
When I think about when you talk about a federal portal, and I like the idea of the navigators who can get you where you need to go, but because every state is different, that's where I think it becomes troublesome. If you're trying to lessen the aggravation for the family caregiver or their frustration with the system, it's almost like you have to get them as close to the service provider as possible. Because if we spend time at the federal level talking about all these programs that may or may not be available, and then they have to contact their local person and kind of go through that all again. So I guess I'm just trying to imagine more like if it were a federal site, something that would get them where they need to go before they spend too much time there. Because hearing about a whole bunch of programs that either you're not qualified for, you're not eligible for, or don't exist in your state could be very, I think, frustrating. And, and that's the last thing I know caregivers need is to waste time doing that. We want to have them go away after that call feeling like, yeah, I found exactly what I need, not I have to go through all this bureaucracy and all this other, you know what I mean? So that would be the only caution I would give on a federal site. Maybe even just, if it were a federal site, it would kind of get them to their local people who they need before going too in depth.
I think you make a great point. We don't want to increase frustration, and maybe something like a benefits checkup, if anybody's familiar with that, where it screens eligibility for federal programs to help drill down. There might be some sort of a screener that can help where you input qualifications, and that can help limit what you see. Too much information is almost as bad as no information. So you make a great point, Lynn.
Right. Yeah.
Thank you. Felicia.
What she was just saying, actually, I guess that wasn't originally what I was thinking about, but maybe if they were looking at a federal site, it would be more of a federal site that would be like, hey, these are your links to your local, and then your local facilities have that direct access to know, like, to a bigger database of all the different programs. That way they can say, hey, start with me, and then we'll go bigger, instead of starting bigger to smaller, I guess. So the federal site, if there was such a site, could possibly start as a way to say, hey, here are your local programs, and then just make sure that we have a pipeline to those local providers that would say, yes, we have this locally, but federally this would be available. But the original thing that I raised my hand for was, I can't remember her name or department, but she was saying about the studies for different age groups, because we get a lot of seniors and we get a lot of children and adolescents, but that kind of middle caregiver group isn't necessarily always heard from. That's kind of the group that I fall into, and my husband, because I'm 44, my husband's 36, and he is paralyzed. And a lot of times there are things that we're interested in or services that we might need that the other groups might not. So I do agree that there is a need for those types of studies, different situations, spousal, those sort of details, demographics need to be explored a little bit more so that we can find the needs for that particular group of caregivers and the people they take care of, and their loved ones. That's all I have to say.
Thank you. Thank you, Felicia. I'm always humbled thinking about groups that I hadn't been thinking about. And when you call out, a situation like your husband being paralyzed, it makes me realize, we just have to keep digging to make sure that we cover everyone, and everyone sees something in our strategies that are going to help them. So thank you. Do we have Liliana?
Hi, I just wanted to say that I added the link in the chat. So the Children's Bureau has been funding these state and tribal kinship navigator programs. So their job is to really have these kinship navigators that can be helping specifically for either grandparents or other caregivers that are raising children. But we have given flexibility to states, so every state may do that a little bit differently. And so we do have a list with all of the state contacts. So I urge you to connect with them and try to find out more. Some of the states are further ahead than others and have really created websites with resource portals where you can put in your zip code and it'll tell you what kind of government or community-based organizations are available, what are the benefits that are available to these grandparent caregivers. But I really think having us help link with other existing navigator programs and using 211 and 311 that's available in almost every state would be a great way for us to really make sure that more people are learning about what are all of the different types of federal programs or state programs, respite programs that are available.
Thank you. Thank you. That's super helpful. I hope everybody sees that in the chat. And I also want to call out, we were talking about websites and someone mentioned the hiv.gov website is a good example. And I would invite those non-federal council members, anyone really even in the general public that's listening, if you have a website as an example to say, this is a great way to organize information, or this might serve to inform a website, then certainly please drop it in the chat or send it to the raised email address. So thank you for that. And Greg, I'm looking at the time. Do we need to move on to the vote?
Yes, I think we can, because we have one more section of some really important information to come on up.
All right. And is this something where you're going to have individuals consent?
No, we're going to pull up a Zoom poll.
Okay.
So the non-federal members, the voting is specifically for the non-federal members of the council. And you will vote on the Zoom poll to whether to move the draft report that you all reviewed and helped us develop into HHS clearance following this meeting. So
all right, let's just take a moment to think how exciting this is that we're voting to move the report into clearance after many hours of work. I know not everybody knows how much work goes in behind the scenes. It was a lot of work, and thank you to everyone who contributed. So here's the poll. I vote to move the report as presented into HHS clearance and final review by non-HHS agencies. And this is for the non-federal members only.
It's saying hosts and panelists cannot vote. So this is Donna, so I can't vote.
Yeah, I'm seeing that same thing on my screen, and it's not allowing me to vote either.
Same with me.
Me too.
okay, is there a way to quickly fix that, Chantal or Cheryl?
Yes, it is fixed.
Okay.
We will relaunch the poll.
Take two.
Thank you.
All right, that works.
Be able to
This
tally
is,
up.
pardon me, this is Daniel Murphy. I had closed the poll when I saw the initial error, assuming that I had opened it up incorrectly. I'm not able to re-access the poll. Or I'm not able to readily see where to re-access the poll. Oh, never mind. I found it. Pardon me.
Are we able to show the progress or what the outcome of the vote is?
We are able, once everyone completes the vote, then we'll be able to. Right now, we have 27 out of 27 showing a 100% with yes.
Okay, great.
Does it switch over to show the bar, Daryl?
It does show the bar.
Don't see it.
Do we have the results? Okay.
Wonderful.
Well, thank you all.
Woohoo!
Thank you all so much. Thank you, Carol, for facilitating this part of the discussion. As we close out our council meeting a little bit later, I will talk about the next steps in the timeline that we'll be using now that the report has been voted into clearance. Obviously, because we're the federal government, we have a process we need to go through. So I will be laying that out and trying to give an estimate for the timeline and what all that involves and what the report will include. So we want to move on to the last section of our agenda, which I think is pretty exciting. And it's certainly an area where we would not be as far along as we are in the realization of a national strategy to support family caregivers were it not for the support of the John A. Hartford Foundation, initially in their support and funding of the National Academy for State Health Policy to establish the RAISE Resource and Dissemination Center to support implementation of the recommendations and the strategy itself, but also to support the work of the Advisory Council. All of the amazing analysis of the public comments, the request for information is all due to their amazing work through the funding of the John A. Hartford Foundation. And we're also so pleased to have now the National Alliance for Caregiving joining the fold, who will be, and you'll be hearing more about their work in just a second, really focusing on the federal actions and interfacing with the federal agencies. So Ronnie Snyder from the John A. Hartford Foundation, if I could turn it over to you to set the stage for this discussion and introduce both Wendy and Mike, that would be awesome.
Fantastic. Thank you, Greg. Gosh, this is so exciting to us as well. So much of the dialogue that just happened was really fun to hear. We hear some of the same kinds of questions in our own boardroom. And so it's just a great pleasure to be here with all of you to discuss how we can support family caregivers and the grandparents who are also clearly caregivers, all of whom are the backbone of care in this country. I'm Ronnie Snyder, as Greg mentioned. I'm the Vice President of Program at the John A. Hartford Foundation. I'm a 50-something woman with mid-length light brown hair, wearing glasses and a brown jacket over a white top. And I just want to note that caregiving is something that I and my organization are really passionate about. I'm here today with my colleague, Scott Bain, who works with me on this initiative and on much of the caregiving work that we do. And so huge thanks back to you, Greg, and to ACL, and also, of course, the RAISE and Supporting Grandparents Advisory Councils for all of your really important work. So if we can go to the next slide, I'll just say a couple of words about our foundation. Some of you know us well, some of you may not. We're a private, nonpartisan national philanthropy. We happen to be located in New York City, but we operate all across the country. And our mission is to improve the care of older adults. So since 1982, gosh, we've devoted well over $700 million to improving care for older people. And we've got these three overlapping priority areas that you can see. We think so much about not just family caregiving, but the way that interplays with building age-friendly health systems, with supporting family caregivers, and especially during serious illness. And the last thing I'll say here is just that we really do have a kind of an overarching theme of collaboration. And that's what Greg just mentioned. We've collaborated very closely with the Administration for Community Living, and that means all of you as well, in terms of this work, and also with our individual grantees and other partners as well. So the really cool thing about this particular RAISE work is the interagency federal work together with the non-federal, the private individuals who represent people in communities. Next slide, please. Just a couple of words about the way we think about our family caregiving funding priorities. We're working to transform healthcare and social services systems to meet the needs of family caregivers. And that's why our grant making is designed to do these three things: improving the ability of health systems and providers to identify, to assess, and to support caregivers, raising awareness among policymakers, health system leaders, other funders, and the public to drive change. And of course, that's so many of you. And creating large-scale change in partnership with national efforts. That's exactly what this is. And we will do this in any and every context that we can work with you to coordinate the work, because I truly view coordination as amplification. And that's another part of what we're trying to do here, is amplify the issues and the needs for caregivers broadly, both paid and unpaid. Next slide, please. So Greg made reference a little bit to this already. So to create those, the large scale change in collaboration with national efforts like this one, and ever since the RAISE Act was passed in 2018, we've been really proud of the close partnership with Greg and with Allison, with others at the Administration for Community Living. And so to augment that federal work in 2019, we made a grant to the National Academy for State Health Policy, as Greg mentioned, for that Caregiver Resource and Dissemination Center. The work has been to support you, to support the RAISE Council and ACL in the development of the ultimate national strategy, which we're so excited about, and all the related activities. And it's included things like research of policies and evidence-based programs to better support family caregivers, convening experts to provide feedback so that none of those who are already expert in this area, the advocates, the folks who care so much and know so much and really have experience, are left out. In other words, providing information back to you and back to the public. And that's part of the reason NASHP was so wonderful, because this is a federal effort and they're a state-based organization. So you'll hear a little bit more about that from Wendy as well. Next slide, and this is my last slide. Our collaboration has continued and grown. And so Greg referenced that, well, we've renewed our funding to NASHP, and that second grant that we have funded to work with NASHP shifted the Resource and Dissemination Center to what we're now calling a an implementation and technical assistance center, because we're really big on building action. So we want to do everywhere possible, implement and move beyond where we already are. So super excited to hear both Greg and also Jody at CMS discuss the kinds of projects that were even beyond what was initially envisioned or expected. And we love hearing about those unanticipated outcomes, as I call them. So NASHP has got their implementation and TA center, and you'll hear more about that from Wendy in a minute. And then more recently, we also are super excited, and we're going to leave the most time for Mike Whitkey from the National Alliance for Caregiving. So we're working with them and new partners as well. And they're dedicated, as I just mentioned, in a different kind of way to bringing action to the strategy. And that different kind of way is very much about advocacy. So our grant funding helped NAC to launch the Act on RAISE advocacy campaign. I suspect most of you have heard at least a little bit about that by now, and Mike can fill you in more so that if you hear from them or if you hear about them, you'll know exactly what that's about. It's completely separate from the Administration for Community Living and its work, because we want to be able to advocate. So Mike's going to talk about that in just a second. The last thing I'll say before I start to pass this on is that it's a together thing, right? Together, all of us are supporting the implementation of the national strategy. And we're just so pleased to be working with the Supporting Grandparents Raising Grandchildren Council, as well as the RAISE Family Caregivers Council, and all of your really critical, important work. We will do what we can to communicate all of the great things that are happening. And so when I heard a little bit about, finding a way to disseminate information in communities, that's a big one for us too. And again, we will both be there to help with that, and we will be ready to help communicate that. So I'm going to invite the representatives of our amazing grantees and our partners, first NASHP and then the National Alliance for Caregiving, who are going to just give a couple of words about themselves. I suspect most of the folks here know who each of you are, and we'll begin with NASHP. So Wendy, thank you for joining us.
Thank you, Ronnie, and thanks to the councils, and congratulations on voting in the report today. Awesome. Okay, I'm mainly going to talk about action steps to support family caregivers. You've heard a lot today about the federal actions. I'm going to talk about everything else. So we're going to do the non-federal actions. Next slide. Okay, you've heard a lot about NASHP, or the National Academy for State Health Policy. I know we've got over 100 people on this call today. If you haven't heard of us, it's okay. What we are, we are a nonpartisan nonprofit organization, and we're all about state health policy. We're of, by, and about state health policy. Next slide. After my talk, if you want to get a hold of me, here's my contact information. We're available and would love to hear from you. Next slide. Okay, as Ronnie said, we are so thrilled that we've been working for the past 5 years in a private-public partnership with the Johnny Hartford Foundation and with ACL. And we have, there are basically 3 things that we do. The first thing, as Ronnie and Greg said, is we try to be as helpful as we can to the councils and to ACL. This is a screenshot here of our resource center. There's the website as well. There's all kinds of materials on there and resources. The second thing, as Ronnie said, is we are all about implementation. We have a national strategy that's amazing, and now we got to get her done. We got to get it implemented. The third thing is we want to shout this out from the mountaintops. And this is where you all can help us. And I'm talking to all 112 of you right now who are on this call. We need you to help us raise awareness about this effort and what is happening and how we can all support family caregivers. Next slide. And here is how you can help. We have a website with that's called supportcaregiving.org. And on it, this is a screenshot that it's a short video that explains what the national strategy to support family caregivers is and why we need the strategy and how we can all support caregivers. So the strategy is amazing. It's very comprehensive, but for all those people that don't feel like wading through all 500 plus actions, this is a great way to do it because it's just a few minutes on this video. We did some paid advertising to get the word out about what these amazing councils are doing and about actions that can be taken. And as a result, we had over 500,000 video views, but that's not enough. So all of you have amazing networks. So please share with the people that you love, the people in your networks, about the national strategy and supportcaregiving.org. Next slide. Also, what we have on this website is a whole set of resource guides around implementation and how various sectors can implement the national strategy. And I'm sure the slide will be up in just a second. But there is a resource guide on there. And these are earlier in the
Hi, Wendy. We were going to show the video at that slide. Did you want to go ahead and share that?
Sounds good. Let's do it. Roll it.
Okay, sounds good.
Chantal, are you the one rolling the gonna roll the video? Oh, here we go.
Caring for a loved one can be rewarding, but it can also be a delicate balancing act that takes a serious mental, emotional, and even physical toll. Many struggle with the amount of time and money caregiving requires. And without support, it can quickly become overwhelming. When all of this falls on you, holding it together can often seem impossible. But we can work together to lighten the load. A new strategy provides hundreds of actions for federal, state, and local governments, businesses, and communities to take to support family caregivers. This historic strategy creates 5 building blocks to improve support. By improving education and awareness to highlight the unique challenges caregivers face, recognizing them as an essential part of the care team, strengthening the level of services and support for caregivers, ensuring their financial and job security through workplace policy and more affordable services, and turning research and data into better practices and support. Together, this is a plan that helps caregivers achieve the balance and stability they need for their families and for themselves. Learn more at supportcaregiving.org.
Great, thank you so much. So that is a way to get the word out about what we're all doing. There are other ways we can do this as well. So we have a variety of resource guides and talk about a portal. It's not necessarily a portal, but we're trying to get there, right? So these are resource guides that provide strategies that folks can take to better support caregivers. And each of these guides, we were talking earlier in the program, somebody had asked, can we really provide concrete actions and concrete examples of what we mean. And that's what this does. So let's go ahead, and we have resources for each of this. And I'll run you through these. On each of those buttons, these are screenshots of the different resource and implementation guides, and it's by sector. This first one over to the left is for caregivers themselves, for family caregivers themselves. So for example, earlier, Sandy in the chat put she didn't know where to find information. In this resource, finding the next page over says finding resources. There's an 800 number where caregivers can call. There's a button that they can click on and type in their own zip code and they get the information. Or like Lynn Gal said, they want to go to their state, they can click on that and it gets them to their state. Also, I noticed Sandy was caring for her mother with dementia. The Alzheimer's Association has a 24/7 call line with a person who picks up the phone and can help. So those and other kinds of resources are in that one for family caregivers, because we want to make sure that family caregivers can help themselves and we can help family caregivers with that kind of information. All the other implementation guides are a little bit different because they're about all the systems that can help family caregivers. Because as we talked about earlier, there really is, it's everybody, right? It's all these different systems and all these different types of providers and communities and states and localities that can also affect caregivers. So in this middle resource and implementation guide, this one was written by the Grand Families and Kinship Support Network and US Aging. So Deborah Stonewalls, who's part of the council, also works for US Aging. And this is for providers. So this is a provider guide to help our grand families out there. The next resource guide, well, if we can go back one, is about caregiving youth. So who are caregiving youth? Well, they're today's 5.4 million children who are actually caring, who are caregivers. And so we thank the American Association of Caregiving Youth that wrote this guide to better help those caregivers. Next slide now. And there's more. So we, earlier we had said, you know, it's great we have all these federal actions, but really where caregivers get their resources and their services, it's at the community level. That's really where the rubber meets the road. So we were really thrilled to be working with and partnering with these organizations that wrote implementation guides for their networks. We're working with the National Association of Counties. They surveyed some of their members, they spoke with their members and created this implementation guide. They're so excited about it. They've been having webinars, and at their national meetings, they've been talking about using this caregiving guide for their programming and education of county executives and administrators. Again, US Aging, working with them and their network of area agencies on aging and tribal aging programs, again, using the national strategy as the framework and providing concrete strategies and concrete examples. For example, shout out to my county, Fairfax County in Virginia, which is in this guide as a promising practice for their amazing caregiver supports and their alert system that you can get on your phone. Okay, next slide. This next guide deals with businesses and human resource managers. Did you know that 1 in 6 employees, they juggle both their work and caregiving at the same time, and we know that number is going up. We also know that businesses, people's employers, are trusted sources of information. So we partnered with the Society for Human Resource Management on how companies and human resource managers can help support family caregivers through better flexibility, benefits, and workplace culture. This next one in the middle, we thought it's really important to reach out to insurers and health plans. This one is written with the National Managed Long-Term Care Plans and the Long-Term Quality Alliance, and making sure that those plans know kind of what are the different strategies for identifying caregivers and how to support them within kind of that plan environment. Ronnie, I know you know about this next one. It's dealing with funding, and we were working with the Grant Makers in Aging that surveyed its members, and these are charitable foundations, and how they're funding better supports for caregivers out there. They found that more than $100 million of investment has been going toward helping family caregivers, and that has been in alignment with the national strategy. So again, not only what's been done, but what other charitable foundations can do as well using the action guide for philanthropy. Next slide. Okay, I can't be working for NASHB and not talking about states. Here are 3 guides for states. We have said again and again, it's come out in the public comments that respite care was important. And so many of our federal partners talked about the importance of respite care and the need to get a break. And so we worked with Rich Lifespan Respite Network. They created a whole work group that analyzed and went through the national strategy and aligned it with specific actions and concrete best practices that are happening in the field to make a change. They just had their conference, and again, use the national strategy as a framework for that conference. And I know we've got some of those respite provider networks. I was seeing them in the chat. So call out to them. The next one is written actually by my organization. That's a roadmap for states. I'm going to come back to that one in a little bit because I'm going to talk a little bit more about it. But I want to talk about the direct care workforce because it's come up again and again and again. We don't have enough direct care workers. We're not paying them enough. They don't have enough benefits. And we really want high quality workforce. We worked with the Elder Care Workforce Alliance and PHI to outline specific strategies for recruitment, retention, and training of direct care workers, and all that can be done and how state policymakers can make an impact. Okay, next. As you can see, these are all the logos so far from all of our partners that have done all this research and all this work on the resource and implementation guides. We have a special call out. As you can see, it takes a village. It's a massive role that, as Nancy said earlier, is a massive role that family caregivers play, and they're affected by all these different organizations. And so we've been thrilled to work with them. Like the national strategy, which is a living document, our work is too. We're not done. This is just the start. Next slide. We are going to keep working with other groups and reaching out to make sure that we are implementing this national strategy. So coming up soon, this is a teaser, there will be one on person and family-centered care. We're working with the National Center on Advancing Person-Centered Practices and Systems. This is a cross-cutting theme across all of the actions that were in the national strategy. So we're super excited about this. It's going to provide all kinds of resources and examples on policies and programs to incorporate person and family-centeredness in what we're doing. Next, please. Okay, I promised I'd talk a little bit about kind of a state roadmap for implementing the national strategy. On supportcaregiving.org, if you want the cheat sheet, that's the one. You can go there and get what you need. Those resource guides are written in bullet points, and they're very user-friendly, and they're shorter. If that's not enough, we have 6 more papers. If you want to read them about what states can do and promising practices, and you can see these are screenshots of each of those 6 papers as part of an in-depth roadmap for states across all the different goals of the national strategy. Next and last slide. And then I'm going to end with a big announcement. As you heard today, we just voted in, or the council has just voted in, the federal progress report that supports the national strategy's implementation. In the fall, we will be releasing with the councils a progress and implementation report highlighting the non-federal actions. Those are the state and community actions that are resulting from the national strategy. It has been my great honor to work with my colleagues at NASHB and to work with the councils and the fantastic folks at ACL and at the Johnny Hartford Foundation. And I'm looking forward to our continued work together. And with that, I'm going to turn it over to our partner, Mike Whitkey from the National Alliance for Caregiving, to talk more about how you all can get involved. And so with that, Mike, the floor is yours.
Thank you, Wendy, and big thank you to ACL and to all of you Act on Raise Council members, both federal and non-federal, and everybody who's on the call today. And even a bigger thank you to the Johnny Hartford Foundation for the support you've been providing to the work around the national strategies to support family caregivers so far, and your support for the Act on Raise campaign, which is what I'm here to talk about today. So a little bit about the National Alliance for Caregiving. We've been around for over almost 30 years now, focusing on family caregiving from a research perspective, an advocacy perspective, and an innovation perspective. And a big part of our mission is to build partnerships to make life better for family caregivers wherever they are, work, home, life, and all and beyond. So the Act on Raise campaign is really focused on the national strategy to support family caregivers specifically. The name Act on Raise came from the Raise family caregiver legislation that was passed in 2018 that started a lot of this work. And we know that there has been the Grandparent Raising Grandchildren Council that has come along together after supporting legislation as well. But the point of the Act on Raise campaign is really to focus in on how we can drive attention on the national strategy from an advocacy perspective. And there's two big focuses for the campaign. And it's not only just about advancing what's in the 2022 version, but it's also identifying priorities that can be taken into account for an updated version. So it's really great to be a part of this meeting today where we've talked about what's happened so far and where things are going moving forward. We've been involved, as I mentioned, with the national strategy effort going back to 2016 as we were helping it from more of a policy legislative advocacy perspective. We worked with NASHB on creating some stories that featured family caregivers that were featured in the first initial report to Congress that was created under the last cohort of Raise Council members. And now it's really exciting to be more formally a part of this effort through this campaign. So there are two main goals for the Act on Raise campaign, and it's to drive implementation of actions outlined in the national strategy and to strengthen the federal level coordination around the national strategy. We're an organization based in Washington, D.C. As we thought about where we could best be providing support for this effort, it was really the national and federal level side of work that we've been doing. So it's great to kind of come on here and echo and complement some of what NASHB just talked about with their state level efforts, because we're really focused on the national and the federal level. And the ways that we're doing this, the way that this campaign is organized is to both raise awareness of the national strategy among members of Congress and federal agencies and national organizations, so that they know this is something that's out there, it exists. There are a lot of different people that have put a lot of work into this and stakeholders that want to see momentum and action. And so that's the second part of the purpose of the campaign is to mobilize and align caregiving groups, patient advocacy groups, aging and disability groups, and even caregivers and those from across the country who want to be a part of taking action in ways that can help advance the priorities and the goals of the national strategy. And then also to have regular communication on the Capitol Hill. We work with members of Congress a lot to highlight all the different goals of the strategy, to help find ways that they can be able to create and implement new policy change that would spur further action than what's currently being done, especially through these federal agencies that we heard from earlier today. So you go to the next slide. So the campaign is really a coalition structure in its formation. This is not just about what the National Alliance for Caregiving wants to do or what we want to see, but it's about how can we create a collective voice and common priorities across organizations representing caregiving, aging, disability, healthcare, and beyond. So you can see on the screen here the steering committee, the logos of the steering committee that we have pulled together to support this campaign. A lot of these organizations are organizations that we see as being really active and vocal in family caregiving. They're organizations we have close relationships with. And so the idea here is that these steering committee members are the ones that are helping us identify priorities, amplify action opportunities through their networks. So just to go through the name of organizations: AARP, the Alzheimer's Association, Alzheimer's Impact Movement, American Cancer Society, Cancer Action Network, the ARC, Caring Across Generations, Diverse Elders Coalition, the Elizabeth Dole Foundation, Justice in Aging, National Council on Aging, National Health Council, Rosalind Carter Institute for Family Caregivers, and US Aging. And as I mentioned earlier, all of this, the work that we're doing through this campaign is supported through a cornerstone investment from the Johnny Hartford Foundation. So I just want to make sure to put another plug out there for the support from them. And then also acknowledge that in addition to the steering committee, since we launched this campaign earlier last year, we've been able to gather a network of over 100 organizational campaign partner members from across the country, and then also 150 individuals on the community level that are not technically affiliated with organizations, but they wanted to be a part of advocacy around this work as well. So we built a strong coalition of national organizations all the way down to the local level. And this is really helping amplify and bring more attention to the strategy and opportunities to make sure it moves forward in various ways. So I'll talk a little bit more about that on the next slide here. So as the campaign launched, we knew that we needed to figure out a way to wrap our head around and prioritize what's in the national strategy. As we've talked about, there's a ton that's in the strategy. There's a lot that can be done on the national level, on the state and local level, within the private sector, that we needed to find a way to kind of prioritize actions and what we were going to do as a campaign. And early on, while we were looking through, all the common elements that we saw, so some of the ways that we've started to break out our campaign priorities is, number one, to track progress and impact of federal actions. So we knew that in the short term after the release of the 2022 version of the strategy, until there was additional congressional or legislative action, a lot of the work on the federal level would be taking place within the federal agencies based on the actions that they identified in the strategy. And we heard a lot earlier today about the progress of those around implementation of those actions, and how that work will lead into language that's going to come up in the next version of the strategy. And we want to make sure that we are highlighting what those federal agencies are doing. There's a lot of work that goes on behind the scenes that people may not be familiar with. And so as it relates to especially engaging the network of folks we've pulled together through the campaign partners and the steering committee and others, a big part of our focus for the campaign is to understand the impact of those federal actions, their status of implementation, so that we can show where momentum is building. And then the next big priority for the organization, you can go back to the previous slide, thanks, right there is good, is to support appropriations around this action, so that we know that the ACL can't do its work unless there's money behind what all of is being put together behind the scenes to organize these meetings and to write the updated strategy and to host the RAISE Council in their work group meetings and everything. So we really are making sure that there's a big part of this campaign is focused on supporting appropriations for ACL as the strategy is being updated. And then we also want to encourage policymakers to bring attention to the national strategy. So we've done this in a few different ways. We've had members of Congress tweet and use social media to promote the national strategy. We've gathered quotes that we were able to use in some of the materials we've promoted with campaign partners. And then we also held a summit here in DC that featured members of Congress and took the national strategy onto the Hill. And I'll talk a little bit more about that later. And then we also provide regular language template updates to campaign partners when there are specific and timely action-oriented priorities that we can highlight. So right now, the Older Americans Act is in the process of going through a reauthorization. So we've been engaging the campaign on what's happening there, providing templates for sign-on and things like that. So as time goes on over the course of the congressional calendar, we're leveraging where there are specific times to take action with the folks in the campaign partners that are a part of the campaign. And then we also are identifying and promoting policy changes that need to implement the strategy. So aside from the federal actions, aside from the kind of like things that are already in motion on Congress, we're looking for ways to get new pieces of legislation considered that would be able to advance what's in the national strategy, because we know that there's so much different policy change that's required. So those are the big campaign priorities that we've identified so far. You can go to the next slide. I'll talk a little bit more about how this is coming into shape. So in the first bullet there, I talked about the federal actions. And what you can see on the screen here is similar to what you saw earlier during the ACL presentation around status of the implementation of the federal actions within the national strategy. But we've also kind of taken our own approach at identifying the actions in the national strategy and figuring out how to prioritize those actions with the campaign partners. So we've looked at all the different agencies, we've gone through all of the different actions, and we've started to kind of organize them as we see them fitting into different goals in the strategy as campaign partner, from our campaign partner perspective, and then have also prioritized those actions to see which of the actions most closely align collectively with the steering committee of the organization, so we can see where we should start taking a bite at the apple and having further engagement with these federal agencies to better understand the impact of the actions. We've also gone through and analyzed the public comments that were released that we heard from earlier to understand where the public thinks we should be prioritizing. And so we took all this analysis together through the steering committee, through our campaign partners, and through the public feedback that we've seen to get a sense of what actions in the strategy align from a priority standpoint across all these different groups. And one of the agencies that we saw show up over and over in terms of the sort of most common priorities that collectively we've been identified across these different groups fell within a couple of different agencies. And the one that we started with taking more of a deep dive into were the actions that fell under the purview of CMS, or the Centers for Medicare and Medicaid Services. So you go to the next slide, and I'll talk a little bit more about how we've kind of taken layers off this onion to peel back what's in the strategy, to get to educate everybody that we're working with through this campaign around what we are seeing as common priorities, and how we can figure out ways to provide feedback or to promote what's happening within the context of these federal actions. So you can see on the screen here that we identified a common set of priority topics that aligned across all these different actions that we saw from this feedback. Things that fell into the buckets of things like chronic care management, caregiver-focused health risk assessments, person-centered care planning, health and home and community-based services and supports, respite care and adult date services, and we mapped those across the actions that were identified in the initial version of the national strategy. And in addition to identifying and mapping all these actions, we actually just had a meeting with the steering committee members and leaders from CMS on Monday, this last Monday, to discuss common priorities, what we've seen as we've analyzed the actions that were in the strategy. And we also got an update from CMS leadership to hear what they've been doing since the strategy came out to inform our priorities moving forward, as we're looking at providing meaningful feedback that may show up in the next version of the strategy, or may just inform the way that CMS is viewing and prioritizing caregiving, so that they understand the collective efforts of all the organizations that we're working with through this campaign. So you can go to the next slide. So in addition to our federal agency outreach, in addition to congressional outreach, we've also been working to promote the national strategy within the purview of the White House. When the national strategy, or when the Act on Raise campaign was first launched, we had a warm reception from the Domestic Policy Council at the White House, from Secretary Becerra at HHS, and from ACL officials, and we were invited to a meeting where we could bring the steering committee members in to talk to these officials that the White House convened and facilitated. And so we had a chance for the steering committee members to talk about some of their initial priorities, why they think the campaign is important, and more importantly, why we should be bringing more attention to the national strategy as a way to promote issues that matter to caregivers, and especially from the perspective of what the White House can do to use their platform to bring more attention to this issue, which they've done several different times. And we've been represented, and along with campaign partners, to the White House to celebrate President Biden's executive order on caregiving. We've had a chance to provide language to the administration that was included in the one of the State of the Union speeches, the most recent one. And then NAC and 5 other steering committee organizations were all represented at a recent White House event celebrating Older Americans Act Month just this year. So we've had several different engagement opportunities that I've heard through some national coalition calls that included the White House, that they have, kind of championed the national strategy and the work that all of you have been doing to make this to come to life. So it's getting out there. People are paying attention to it, especially on the national level from our perspective. And we're really excited to be able to partner with you all on making all of this come to life in some form or fashion. You can go to the next slide here. And so a couple of things that we have coming up. The slide that I showed you about all the different federal agency actions and how we've been grouping all those up under different goals. One of the things that we are doing to try and map out what's happening across the federal agencies and this is something that's in the pipeline right now that will be released soon, is we're creating a dashboard that's specifically focused on status of implementation of the federal actions that you saw on that grid that we had on that slide, and that you saw in the slides that were shared earlier by ACL. So once that implementation update from ACL has become public and we're able to share that information, we will use that public information to share to promote among campaign partners, amongst our network, and amongst the steering committee where the national strategy stands in process of implementation. So the other thing that we're doing to track, to map issues and priorities related to the national strategy, is we're putting together 2 other separate documents in addition to the dashboard around federal actions. One of the other documents is going to be designed for members of Congress so that they can see where collectively as a campaign, we think that there is the most opportunity for additional legislative change that would be required to implement each of the goals in the strategy. So that's what we're calling a RAISE policy playbook that we'll be putting out pretty soon, in addition to this dashboard that's more agency focused. And then aside from the agency focused dashboard, aside from the playbook that's going to be designed for members of Congress, we'll have a third document that will kind of give a highlight of an overview of what we've seen across different stakeholder organizations, whether they're national organizations, whether they're state level partners, whether they're grantees who have been working with ACL to implement parts of the strategy, other things that congressional champions are doing, and what we can do to highlight federal agency work. We're really kind of going to be mapping out where priorities and issues are shaping up and being highlighted from other stakeholders across the landscape. So we'll all kind of get a sense of, from our perspective as a campaign, where we're seeing some collective agreement around priorities that we can all work together for as it relates to advocacy, specifically on the national level. You go to the next slide here. And then the big thing that I would like to just bring to everybody's attention is, because we've been doing so much work with members of Congress, with these federal agencies, with national partners, state level partners all across the board, as of last year in October, we launched the first ever Caregiver Nation Summit here in Washington, D.C., where we brought together over 150 advocates, members from the research community, just people who are really strong champions and stakeholders in family caregiving and want to learn more about taking action and doing advocacy on the national level. We held a summit where we had a day of speakers and panels. Allison Barkoff was one of the keynote speakers that we had there. Senator Bobby Scott from the House side was another featured speaker that we had. And then we held a briefing on the Senate side that featured Senator Markey. So we had a different, this was an opportunity for members of Congress to come and talk about the importance of the strategy and what they're doing to support implementation. For people from around the country to be able to come and hear about sort of what's happening on the policy side of things. And then we also brought in a state network that we're now working with, We have this during the summit, we brought 10 different states to DC to go and meet with their elected officials to bring attention to the national strategy and to share why the national strategy is important to them and the people that they work within their states. So this was a way that we brought the voices of caregivers, the voices of advocates directly to DC to meet with their elected officials and say specifically that we think the national strategy is important. There needs to be ways to advance it, and we want to develop champions who can help do that. So that was a big groundbreaking event that took place, and we're going to do it again this year over the course of the 19th to the 21st. We'll have another day of another summit day where everybody's going to come together, and we'll have a lot of great activity to cover. And then we'll send state level partners back out on the Hill again to talk with their elected officials and hear more about what's happened with the strategy since last year, since we did the first summit. And then we'll have a lot more great material coming out of what I know we're going to be seeing released by ACL pretty soon here, especially around this congressional report and what federal agencies are doing to help inform an updated perspective on where things are taking place. And then the last slide that I have here is to share that we have a website where everybody can see what we're doing with the Act on Raise campaign. It's called actonraise.org. I think it got caught up on the bottom of the screen here, but you can just take down actonraise.org and I will drop it into the chat also. You can go, there's a couple of things to highlight with that website. Number one, if you want to see everything we're doing with the campaign, you can kind of look through what we have housed there. We have things related to news announcements and media, any policy briefs that we do go on there, anything that we're seeing in terms of like landmark updates that show momentum, we try to make sure are on there. But if you want to join as a campaign member, you can get access to emails that we send out regularly to show, you know, when we have calls to action that you can participate in. When we release new documents, whether it's a policy brief or whatever, or something along those lines, you can get access to that stuff immediately. And you can just get a better sense of what's happening on a timely basis within the context of the campaign without having to go back and recheck the website all the time. So you can, if you join to sign up, you're not automatically endorsing any legislation or supporting any policy positions, but there are opportunities to do so through sign-on letters and things like that we put out as a part of.
Thank you, Mike.
So
we're at about time, so I want to wrap this up. Go ahead if you want a last word.
That was it. That was the end. That was the last word. Just to say thank you again and good to be here today.
Thank you, Mike. Thank you, Wendy. I think everybody can see the incredibly thorough, incredibly dedicated, and quite frankly, sophisticated work that's happening all together through NASHP, together with NAC, thinking through priorities and impact. And we welcome all of your thoughts. And with that, I want to turn it right back to you, Greg.
Thank you so much, Ronnie. And thank you to Wendy and also to Mike for taking the time to talk about your important work. I was so pleased to be able to have the National Alliance for Caregiving join us as a new partner in this effort, because I know that they're going to be working and reaching out to all of our federal partners on the council. And I wanted each of you to be aware of their work and its importance in helping us advance this overall initiative. And certainly they're doing things that we as feds can't do. And so from my perspective, that's really wonderful. And obviously the work that NASHP is doing is really giving legs to being able to implement all of the stuff that's in the national strategy. So I look forward to continuing to work together. So as we wrap up here, I just want to provide the folks on the council, as well as the attendees from the public who are watching, a sense of where we go with the next steps here. So as you saw earlier today, the council members voted the draft report into Congress. The report, when it's presented, is going to consist of several components. There will be a cover welcome letter from Allison Barkoff, which really frames this progress report in the broader scheme of what's been happening within the administration, within Washington and around the country, in everything related to caregiving, the care economy, the Biden administration's priorities. We will then have a narrative report document, which gives some really interesting details about some of the impacts that we've been seeing at the federal level with as a result of the national strategy. We have a section that talks about some of the international attention that the strategy has gotten. Allison and I, for example, had a chance to travel to Ottawa, Ontario last fall to help Canada kick off their own process to develop their own Canadian national strategy. And they were looking to the national strategy here in the US as one of the models that they're going to use. So this report narrative will present a lot of that information. It also has an appendix that lists agency by agency some highlights of their overall accomplishments. And these were reported back in the September meeting last year, as well as a description of the nearly 40 additional actions that several of the agencies added to the strategy after its release. So not every agency has additional actions, but quite a few do. The report will also contain, once it's posted live on the acl.gov website, agency-specific Excel spreadsheets that outline each one of the agency actions and its status with respect to implementation. And so it's that completed, in process, not started, modified, what have you. So agency by agency Excel spreadsheets that are broken out goal by goal. So it should be relatively easy to search. Where we have information available and where the agencies have provided it, they are providing links to the outcomes of those actions, where they stand, if they're in progress, and additional information. So we believe that that should provide a fairly comprehensive look at where we stand with implementing the national strategy. I will admit that it's a cumbersome way to present a bunch of information, but because we're going to so many different federal agencies, it's difficult to have a common SharePoint and manage all of that. So we're working on, streamlining how we present it. So this report was voted into clearance today. We have some packaging to do over the next couple of days at ACL. We expect to move the clearance package to the department early next week, Monday or Tuesday. We anticipate, given the time of year that we're in, getting closer to an election, that the internal HHS clearance process will take approximately 6 weeks. And this involves a back and forth between ACL and many of the agencies providing comment that we have to respond to, negotiate with, and make edits based on the feedback we're receiving. At the same time that's happening, we're going to be sending this report to our non-HHS colleagues. So for example, Department of Labor, Consumer Financial Protection Bureau, the VA, for their final review and sign off and approval. We anticipate 1, maybe 2 rounds of back and forth to get everything cleaned up. It will then move into final copy editing, layout, and design for web posting. That's a couple-week process. And so we anticipate delivering this report to Congress and posting it publicly on the ACL website by mid to late August. And that's if everything moves quickly. And I am going to be on it like crazy to make sure that we don't get bogged down in the clearance and review process. In the meantime, once that's underway, Lori, Jonathan, and I are going to continue working with the respective councils to begin considering, and they have already been working on considering updates to the national strategy, where we move next. We're going to be picking that work up again now that we have this report moving through clearance. We're in a good place to resume working group meetings and subcommittee meetings to really begin taking apart the existing strategy and looking to where we can update it. So that's where we stand with next steps. I'm sorry I can't give specific dates, but so much of this will involve, forces beyond my control. But we will do everything we can to keep it moving, and we look forward to making a huge announcement when this report is ready to be released. So with that, I will see from members of either council, do we have any questions or input before we adjourn? Okay. Seeing none, hearing none. I want to thank the members of the councils for their time today, for all that you did to contribute to this progress report. We look forward to getting it out there to really elevate and present the great work that has happened. With that, we will adjourn for today and stay tuned for and watch ACL updates later in the summer for when we announce the release of this report. Again, thank you, and this meeting is adjourned.